into or part of the actual theme that may follow thereon from their presentation, but for them to have the liberty of being able to deliver the perspectives that they so choose to in their respective capacities. So here we are after lunch, and we invite now to deliver remarks the Prime Minister of St. Kitts and Nevis and lead head with responsibility for human resource development, health and HIV/AIDS. Ladies and gentlemen, please welcome the Honourable Dr. Terence Drew.
Good afternoon, all. Thank you, Master of Ceremonies, and following your orders, I will adopt the protocol already established. But allow me to recognize, of course, the organizer of today's symposium, the Prime Minister of beautiful Trinidad and Tobago, the Honorable Rowley. And to recognize all the other heads of government, ladies and gentlemen, good evening, good afternoon. Let me say that I came to Trinidad, maybe not with the broadest smile, because of the issue that we were facing. And after this morning's discussion, I think that my smile will be well represented, with the hope that I am now imbued with, that we are really putting now the political will to get this problem dealt with here in our region. So I'm very, very grateful for that. I'm grateful for the opportunity to speak on the challenge of violence, and possibly specifically youth violence this afternoon, because I think from the data you saw, you would have recognized that violence and criminal activities, especially dealing with gun activity, is mainly an issue of young people. At the outset, it is clear that much work has been done to document the risk factors, the characteristics of victims and perpetrators, and the impacts on the individual, families, country, and region. Solutions have also come to the fore, so there is reason for me to be very optimistic. In 1996, the World Health Organization was correct to declare violence as a major public health issue. Then in 2002, the World Health Organization report on violence said this: gangs and a locally supply of guns and drugs are a potent mixture, increasing the likelihood of youth violence. St. Kitts and Nevis accepts this formula: gangs plus guns plus drugs, a key driver of our gang violence issue. By the early 1990s, we witnessed young adults, then high school students, organized in transnational traffic of drugs. The groups of brothers and sisters became deadly territorial as they protected their turfs with imported guns. Such is the influence that by 2018, we saw some primary school children who were gang members rather than being constructively engaged in organized arts, culture, and sports. What push-pull factors cause some children to be ensnared by a subculture of mental and physical violence? Why are they not, some of them, being inspired to be Carifta Games participants? Why the seemingly overpowering appeal of get rich quick or die trying? I am advised that the habits of thought or the thought model is operative. It speaks to chronic, toxic, early childhood experiences that erode mental resilience. So much so that by or before mid-adolescence, violent behavior spills out of the homes and onto the streets as a disease. In November 1937, Marcus Mosiah Garvey, national hero of Jamaica, came to St. Kitts and Nevis to speak. Then he was speaking to my grandparents. And among the pearls of wisdom that he left was this: man is a product of his mind. In other words, violence is a learned behavior. I am a medical doctor, and what is learned can be unlearned, provided that there is a definition of the issue and early application of best practice interventions. Speaking of definition, for 2 decades, Caribbean public health experts have known that, like measles, dengue fever, and HIV/AIDS, violence is characterized by the epidemiological triad of disease causation. The triad elements being an agent, a host, and an environment. Very critical. For example, COVID's agent is a virus. We are somewhat familiar with the triad, especially because of COVID that has affected all of us. And so extending it to COVID, we would say that COVID, or the agent of COVID, is a virus. The host are animals and humans. An environment dominated by structural, social, and commercial determinants of injustice, inequity, and ill health facilitates transmission and virulence. We know this already. In youth violence, the agent is chronic exposure to especially family-based toxicity. The primary hosts are children. Enablers are the determinants of injustice, inequity, and ill health, including easy access to guns that we do not produce here in the Caribbean. Further studies, of course, is that public health and security experts can produce maps of violence hotspots, and I think we saw one this morning. They know the demographics and geographics of clusters. There are graphs of incidence versus time, which depict a series of epidemiological curves. Therefore, the violence challenge in the Caribbean appears to be well characterized as a public health issue with ominous social and economic implications. Neither good health nor development are possible in a climate of violence. We need, and I term it today, we need violence climate change. The pressing leadership task is to resource and apply best practice interventions. In that regard, the work of Dr. Gary Slutkin, World Health Organization, and others is instructive. 3 primary intervention fronts are recommended, and I will name them. 1, interrupt the transmission. 2, prevent further spread among the exposed. And 3, change societal behavior norms. In one way or the other, we heard all 3 this morning, and that is why I say I am optimistic. And if these sound familiar, they should. They were part of the public health toolkit to mitigate COVID. I regard this regional symposium, therefore, as a coalition of the willing. Notwithstanding the delays because of a pandemic, there's a window of opportunity to move the needle now to solutions. Our people must see and must feel solutions now. So I came convinced and want to leave SEAS with a commitment to train people with street credibility to function as violence interrupters. We can track and trace young people experiencing toxic exposure or who are high risk for the same, we can find them and offer them a suite of interventions to deal with the many issues. We can roll out a campaign of culturally appropriate public messaging using the talents of known social influencers. We heard that this morning as well. Several experts I know will follow me, and I look on the long lists of those who are versed in the field. And as a medical doctor and one in the field, I expect them, and they will do it, to be factual and forthright about the required resources to deal with violence from a public health standpoint. So I'll tease them by saying how struck I was with the data produced in 1992 by the US Government Accounting Office. For those who wonder if this makes monetary sense. Specifically, it says that violence prevention programs can save $6 to $8 for every dollar invested. I think I want to say that again, because money will always be the elephant in the room for some. It says that violence prevention programs save $6 to $8 for every dollar invested. The US GAO, as I just referred to, the conclusion that violence prevention funding is smart money is accepted, and to my mind, a political imperative. We need to do it. Therefore, gathering research evidence on violence is not the rate-limiting step of the Caribbean action of finding a Caribbean solution. The research and evidence is not the issue. We have it. We heard it. The issue is political will. Will we do it? I end, of course, with a quote from Martti Ahtisaari, 10th President of Finland and Nobel laureate, and he said, and I quote, "If the political will is there, we can solve anything." I'll repeat, if the political will is there, we can solve anything. And from today's presentation of the heads of government, the interaction and the erudite presentations that they would have made tell me that the political will is there. So the Caribbean has a proud track record of solving and mitigating major public health issues through robust, evidence-guided intervention programs. We know them. We had to deal with AIDS and HIV. Not as individual countries, but we dealt with it as a region with evidence-based approaches, and we have success. We are also dealing with NCDs, chronic non-communicable diseases, and we are dealing with that issue from an evidence-based perspective. And so the challenge today, we are looking at violence as a public health issue. And it's quite interesting that it's our geologists who have brought us together. I think his scientific mind tells him that evidence-based approaches resolve situations. And today, we are taking that bold step. And that is why I am optimistic that we have seen the evidence, we have gathered the evidence, and we are willing to put the political will using that evidence to solve violence from a public health perspective. There is hope, and I wish this symposium and all that we do success. Thank you very much.
Thank you very much to the Honourable Dr. Terence Drew, Prime Minister of St. Kitts and Nevis, for delivering remarks as we resume here this afternoon. Prime Minister, thank you. We move now to the subject theme area, violence as a public health issue, the crime challenge. And on this occasion, there is a video presentation coming from His Excellency Dr. Isben Williams, psychiatrist and former ambassador to the United States and the Organization of American States. Ladies and gentlemen, it's a bit long, so I ask that you put the stamina of after lunch into high gear so that we captivate your attention. I promise you that on the other side of the presentation, you'll be kept well alive. So please direct your attention to the screen for His Excellency Dr. Isben Williams.
Good day to all the participants taking part in this important meeting, which brings together CARICOM leaders at the highest national and regional levels to discuss and find solutions to our epidemic of societal violence and crime, having regard for their implications, not just for citizen security, but also for national and regional development. I'm grateful for the opportunity to share some thoughts on this issue with you. I regret, however, not being able to attend in person as my current circumstances, albeit temporary, dictate otherwise. For his foresight in mounting this initiative, I am sure you all join me in thanking the convener of this sorely needed symposium, CARICOM's lead head in security, Trinidad and Tobago's Prime Minister, the Honorable Dr. Keith Rowley. Permit me also to adopt the order of acknowledgements which preceded, save for acknowledging the presence and participation of the current chair of CARICOM Conference of Heads, the Honorable Philip Davis, KC, Prime Minister of the Bahamas, CARICOM's lead head on health, Prime Minister, the Honorable Dr. Terence Drew of St. Kitts and Nevis, my Prime Minister, Secretary General of the Caribbean Community of Nations, Her Excellency Dr. Clara Bennett, CBE. Distinguished ladies and gentlemen all, in the time allotted me, I invite you to position your thinking, or perhaps to reposition your thinking, for a while on the issue of violence prevention and to envision it as a developmental imperative, a critical dimension of development for the global community, but particularly for such regions as the Caribbean states, which have not had great success at remedying this problem. Violence has become one of the most preeminent developmental issues facing policymakers and one of the most persistent challenges in today's global agenda. Its negative impact on social and economic development in many countries has been well documented. Violence takes many forms and has many faces. Its various manifestations all converge to erode the well-being of us all and to stymie development efforts. It is undeniable that the anxieties and the hypervigilance caused by the possibility of violence being perpetrated against any right-thinking one of us all too frequently pervades our thoughts. For how can we escape such anxieties, triggered as they are by being bombarded daily and relentlessly on many fronts with stories of violent occurrences happening around us? We have all come to appreciate the risk of our personal safety, to experience some measure of unsafety. For many of us, staying out of harm's way may be a matter of locking our doors and windows and avoiding dangerous places. For others, escape is not possible. The threat of violence is behind those closed doors, well hidden from public view. And for those living amidst external threats or conflict, the risk of violence may permeate every aspect of their lives, their thoughts, their feelings, and their actions. Many who live with repeated violence in whatever form over an extended period may have difficulty disabusing their minds of the faulty notion that violence is an intrinsic part of our human condition to which we should adapt. Not so at all. Violence can be prevented. We now have the knowledge, we have developed the tools, and we must now harness the courage to face up to it and reverse its trend. Violence is now clearly recognized as a public health problem. But just 40 years ago, the words violence and health were really used in the same sentence. Several serendipitous occurrences and observed trends contributed to a growing recognition and acceptance that violence could and should be addressed from a public health vantage. Firstly, as the Western world became more successful at preventing and treating many infectious diseases, it was observed that homicide and suicide rose in the rankings of cause of death. Tuberculosis and pneumonia were the two leading causes of death at the turn of the century, the 20th century. By mid-20th century, the incidence and mortality from these infectious diseases, along with others such as yellow fever, typhoid, poliomyelitis, measles, and diphtheria, were dramatically reduced through public health measures by sanitary control of the environment, isolation of contagious disease cases, immunizations, and the application of new and therapeutic medical techniques. Violence became a phenomenon of greater focus by the US Centers for Disease Control and in public health because in the USA the risk of homicide and suicide reached epidemic proportions during the 1980s among many specific segments of the population, including youth and minority groups. Suicide rates among adolescents and young adults 15 to 24 years of age almost tripled between 1950 and 1990. Similarly, from 1985 to 1991, homicide rates among 15 to 19-year-old males increased 154%, a dramatic departure from rates of the previous 20 years for this age group. This increase was particularly acute among young African-American males. These trends raised concern and provoked calls for epidemiologic inquiry and for new solutions. Another important development was the increasing acceptance within the public health community of the importance of behavioral factors in the etiology and prevention of disease. It is now generally accepted that prevention of 3 of the leading causes of death in the United States, heart disease, cancer, and stroke, rest clearly and largely on behavioral modifications such as exercise and change in diet, smoking cessation. Successes in these areas encourage public health professionals to believe that they could likewise overcome the same behavioral challenges underlying interpersonal violence and suicidal behavior. And thirdly, the emergence of child maltreatment and intimate partner violence as recognized social problems in the 1960s and 1970s demonstrated the need to move beyond sole reliance on the criminal justice sector in solving these problems. This is a public health foundation upon which the proven steps in violence prevention rests. Surveillance, identifying risks and protective factors, developing and evaluating interventions, and implementing programs born of sound policy. Moving forward into the global context, As the public health efforts to understand and prevent violence gained momentum in the United States, they also garnered attention abroad. Violence was placed on the international agenda in 1996 when the World Health Organization, the World Health Assembly, adopted a resolution which declared violence a leading worldwide health problem. The resolution requested the WHO, World Health Organization, to initiate public health activities to document and characterize the burden of violence, assess the effectiveness of programs with particular attention to women and children and community-based initiatives, and to promote activities to tackle the problem at the international and country level. In the year 2000, the World Health Organization created the Department of Violence and Injury Prevention to increase the global visibility of international injury and violence and to facilitate public health action. The organization's World Report on Violence and Health, published in 2002, is now used throughout the world as a platform for increased public health action towards preventing violence. Despite public health professionals having contributed to the understanding of violence, using epidemiologic methods to characterize the problem and identify modifiable risk factors, enlightened methods of violence prevention remained in too many global jurisdictions, and adapting to the new paradigm shift has been somewhat a hard sell. How does the Caribbean fit into this global violence prevention scenario? Well, globally, homicide rates have been a gauge for the incidence of societal violence. It is couched as the number of murders per 100,000 of population. The global homicide rate for 2019 was 6.1 per 100,000. Homicide rates have been consistently high in the Americas for at least 3 decades and have remained high in the Americas even as they plummeted elsewhere. The region's average rate remained at the same level between 1990 to 2016, fluctuating slightly from a low of 14.5 to a high of 16.7 per 100,000, compared with a global average that varied between 6 and 7.4 over the same period. The rate in the Americas jumped to 17.2 in 2017, reaching the highest level since the late 1990s. Africa came in a distant second with a homicide rate of 13. The Caribbean sub-region of the Americas has also consistently led mainland America. According to a joint UN-ODC World Bank report of 2002, the Caribbean had attained a level of 30 homicides per 100,000 at the beginning of the decade, the first decades of the new century. These rates must give us at least cause for pause. Yet, as the Caribbean community of nations reels and quivers from the acute and chronic ecological impact of violence and its varied manifestations, I am heartened and proud to realize that our leaders are prepared and emboldened at this time to seize the moment in reversing this trend. Violence constitutes a common enough occurrence in our daily Caribbean lives, even if not necessarily impacting most of us directly or personally. Nevertheless, we should guard against ever bringing ourselves to regard it as an inevitable part of our social and human condition, an immutable characteristic of our daily lives to which we must find ways of adjusting or responding to the extent that we find possible. Rather, we must regard it as a phenomenon that can in fact be curtailed or prevented. Violent cultures can be turned around and cultures of nonviolence vigorously promoted. There are many remarkable and shining examples of how violence has been countered, and not primarily with law and order approach, nor repressive pushback or coercion. Because of the multifaceted character of violence, it has been shown that what is required to abate its progression is broad engagement of all societal sectors, government, civic and corporate sectors, academia, the citizenry, and partners at all levels, local, national, regional, and international. And the key role should always be played by development agencies. Even with the increased awareness that violence can be prevented, a commensurate level of appreciation among policymakers and program developers is still necessary. And even such understanding by itself is insufficient unless there is the unfettered will for essential next steps to be taken in shaping appropriate data-driven responses. I cannot overstress data-driven responses. Hence, I entreat you to arm yourselves and those you entrust with taking over the rudder after this symposium is done. Gird yourselves with evidence of what is known to have worked to curtail the impact of this scourge of societal violence and to apply this knowledge to all our benefit. For as is well known, the essence of knowledge is having it to apply it. Defining the nature and extent of violence is a necessary first step toward fully comprehending the phenomenon of violence. Homicide rates are not the only indicator of societal violence. Homicide rate is a measure that is used most often to determine overall levels of violence in a city or country, because homicide constitutes the most serious and publicly visible of all violent acts, and it is usually reported more accurately in statistics on violent crime. It is estimated, however, that for every young person killed, 20 to 40 receive non-fatal injuries that may have required hospital treatment, and the preponderance of the victims of violence never access needed medical care, particularly for the types of violence that are stigmatized, such as domestic violence. Homicide rates represent, therefore, a fraction of the tip of the societal violence iceberg. In 2005, the heads of government of the Caribbean community commissioned a report on the health situation in the region. Among the findings of the Caribbean Commission on Health and Development, which was chaired by Sir George Allain, was that there were 3 health issues looming large, which had the potential to stymie growth and development in the community of nations and which needed to be addressed as priorities. These were HIV/AIDS, chronic non-communicable diseases, and violence and intentional injuries. Progress in addressing HIV/AIDS has been significant. The Pan-Caribbean Partnership Against HIV and AIDS, which is dedicated to this health issue, had been established, in fact, since February 2001. It has provided a unified vision and direction among all partners in reducing the spread and mitigating the impact of HIV in the Caribbean. PANCAP is now recognized by UNAIDS as a global best practice model. Commendable strides have also been made more recently regarding chronic non-communicable diseases, NCDs. In fact, it is the CARICOM states that were instrumental in placing this issue on the agenda of the United Nations General Assembly in September 2011, when world leaders convened at UN headquarters a high-level meeting on NCDs, non-communicable diseases. Violence and injuries was a third issue identified by the Caribbean Commission on Health and Development as needing immediate redress. Although as much a health and development issue as the other two, it straddles the purview of many other sectors, including public security, governance, law enforcement, and education, among others. Perhaps because of its complexity as an issue and the many sectors to be engaged, it has not yet gained the traction it deserves. You, the participants of this high-level symposium, have the capacity to change that. I entreat you to do so, if only having regard for its being a critical dimension of development. I have heard the opinion expressed that after the deliberations of this high-level symposium and its planned follow-up actions, nothing short of an agency, partnership, or alliance, an organization akin to PANCAP, capable of developing and implementing policy for preventing violence and reducing its impact, and reducing the rate of homicides, in which we are frontrunners, would justify our efforts. Perhaps so. I have faith that our heads, being at the end of this exercise better seeds of the problem, would at this juncture make the sound decisions in tackling this challenge and taking it forward. Violence is often not only preventable, but also predictable. Many of the factors that increase the risk of violence are shared across the different types of violence and are modifiable. Hence, while public health does not offer all the answers to this complex problem, we must be determined to play a role in shaping responses peculiar to our ecologic and sociocultural realities for better outcomes, and thereby make the Caribbean and the world a safer and healthier place for all. I thank you for your attention, and I trust that your deliberations will be very fruitful.
There we are. Okay, we're back. Truly engaging, and our thanks, of course, to His Excellency Dr. Isben Williams for perspective, as well as pointing a way forward, if only that, of course, the suggestions that come forward here dovetail with all that's being discussed for the two-day symposium. Ladies and gentlemen, we move now into the plenary session that allows us to have presentations on the overview of violence and health, crime and violence, a public health approach, violence is a public health issue, the Bahamas experience, accident and emergency experience, mental health as well being discussed. The moderator is Senator the Honorable Dr. Amory Brown, Minister of Foreign and CARICOM Affairs of the Republic of Trinidad and Tobago. I invite Senator Brown to join us on stage at this time, and we invite the panelists to also make their way on stage. So will you please welcome Mr. Dean Chambliss, Dr. Roy St. John, Dr. David Allen and Kevin Bethel, Dr. Robin Sinanan, Dr. Hazel Othello. So my brand name over the next 2 or 3 sessions is going to become housekeeper. As you make your way on stage, please ensure that your microphones are now on. Just to check before you make your way to your seats. And I'm being guided for those who have now made their way on stage.
I'm fine.
Right, we're all good. That this large monitor here that happens to carry a countdown clock that can make its way across all 4 is to ensure that not only do you provide your elucid remarks, but that you also keep us back on time. And magic is going to happen that by 6 o'clock this evening, we will have done it. But it all depends on your participation from here on in. So good luck. I turn you over to Senator the Honorable Dr. Amory Brown, who will lead us forward for this session. Minister.
Thank you very much, Wendell. I wish I had a time machine, because the challenge placed before us is that we are starting a session at 3:15, which should have ended at 3 p.m. And I've been asked to get us back on time. Prime Minister, what a challenge. I would first like to ask you to join me in expressing appreciation and showing appreciation to the heads of government that have come here to Trinidad and Tobago to participate in this forum. And the stage was very much set for this plenary session by the Prime Minister of St. Kitts and Nevis, a distinguished medical doctor himself, who really helped put into perspective the discussion that we are aiming to achieve in the next few minutes, getting into the health component, the public health component of this symposium. And it really is a bit of an unusual turn for the contemplation of many of our publics, who very often would consider the front lines in the fight against violent crime to be our police officers and security professionals. But now we are recognizing more and more that there's great value in terms of information and in terms of solution coming from our healthcare practitioners, our mental health experts, our public health strategists, and others that are now becoming involved. And as Dr. Drew set the table by saying, we have to be evidence-based, guided by evidence, and it has to be a multi-sectoral effort. Well, I'm sitting here surrounded by some of the key components and representatives of a very important sector in this effort. Time is not with us, so I will spare you my quotes from Shakespeare and all the other things that I prepared, and seek to get right into the discussion. But there's something that was said in the presentation a short while ago that triggered my thinking. And I thought of a 13-year-old boy who right now may be presenting at a public hospital here in this country, or in Grenada, or in Jamaica, or the Bahamas, or elsewhere, with a stabbing injury. He's treated, he's discharged, and maybe 2 years down the road, he's 15, he presents with a gunshot wound, a wounding. He's treated, he's discharged, and maybe 6 months later, he joins the statistics of homicide victims in our country and in our region. How many opportunities would we have had to intervene during that trajectory? And then maybe we need to go back before his age of 13. Was he involved in violence previously? Was he the witness of violence or exploitation perpetrated against his mother? Were there opportunities to diagnose mental health challenges that he himself may have experienced, or that his parents may have experienced? Would he have benefited from child development support in his early years that may have altered the trajectory of his life? I think those are some important questions for our contemplation. To help us move forward with the discussion on the health component, the public health analysis of our challenge and presentation of our solutions, we have a very distinguished panel with us this afternoon. I would like to begin the next component of this discourse to turn the microphone over to Mr. Dean Chambliss, who represents the Pan-American Health Organization, PAHO, well known to us, and he is the Sub-Regional Program Director. Mr. Chambliss, I would like you to now begin your presentation, condensed as it is required by the circumstances, but to help us move further into an analysis of the public health component of violence in the Caribbean region. Please.
Thank you, Dr. Brown. This appears to be working correctly. So good afternoon, and thank you very much for this opportunity. I bring greetings on behalf of PAHO's director, Dr. Jarbas Barbosa. We had a little segment earlier that touched on social media. I would like to assure you that I am not, in fact, checking my Facebook on this phone, but that I have my speaking notes here. So thank you for your indulgence on that. It is indeed a jarring juxtaposition that perhaps the most beautiful region in the world, the Caribbean, is suffering such a wave of violence that this high-level symposium is necessary. Yet, we must face facts. Per the World Health Organization, the region of the Americas has the highest homicide rate in the world, both for adults and, even more tragically, children. Our homicide rates are more than 3 times the global average, and 10 of the top 20 countries and territories in terms of the intentional homicide rate are located in the Caribbean. I was going to provide you with more statistics on violence in the Caribbean. However, in view of the prior extensive information provided just now by Dr. Williams, I will not repeat what he has so ably presented to you. I would note, however, that PAHO WHO has long worked with our member states on violence prevention as a public health priority. We've had a particular emphasis on violence against women, children, and youth, focusing on how health systems can help to prevent and respond to violence as part of a multi-sectoral response. One thing has long been clear, and that has been re-emphasized at various points today, that fighting crime and violence is a whole of society struggle, from parents to teachers, to health workers, to church leaders, to policemen. We must all work together as we deal with this most pressing and challenging of problems. PAHO applauds the clear-eyed commitment by Caribbean leaders gathered here today to tackle violence in our societies with fresh ideas and evidence-based approaches. A public health approach to violence prevention recognizes that different forms of violence intersect and compound each other. As highlighted earlier by the Trinidad and Tobago Commissioner of Police, a public health approach to violence includes 4 key steps. Step number 1, defining who is most affected and by what forms of violence. Step number 2, why does it happen? Identifying risk and protective factors. Step number 3, how can we try to change it? Developing and testing prevention strategies in selected target communities or other settings for proof of concept. Step 4, how to scale up and continue learning. We need to assure widespread implementation of effective strategies, expanding to the national level and examining sustained impact. PAHO WHO recommends a range of cost-effective and practical interventions that can lead to real change. I would note that the interventions I'm going to describe are in line with much of what we heard from the Prime Minister's panel this morning. Evidence confirms that children who witness violence in their homes are more likely to perpetrate or experience violence later in life. Violent discipline and corporal punishment in childhood increases the risk of involvement in bullying as an adolescent, and in turn, the risk of gang involvement and criminal activity. But we have an opportunity to intervene early and to break this vicious cycle. As early as during pregnancy and the first months after birth, we must reduce the probability that a child encounters violence in their home. This means tackling violence against women, especially that perpetrated by their husbands and partners. Economic strengthening programs are key, including offering microfinancing and cash transfer programs, combined with training to help women and men to understand the role gender plays and to adopt egalitarian attitudes. These strategies can improve a household's economic situation, thus reducing the risk of abuse and neglect, while potentially increasing access to education and other protective factors. In very young children, we must recognize the potential harm of using corporal punishment to discipline and to teach. We know that there are other ways of fostering safe, stable, and nurturing relationships between parents and their children. In early adolescence, children spend a large amount of time at school and with their peers. They may be involved in bullying and physical fights as victims or perpetrators. The right school environment can turn this around. For older adolescents and young adults who may be at particular risk or already engaged in violent activity, it is critical that we consider mentoring, such as Big Brother and Big Sister programs, connecting at-risk youth with role models in their communities. When responding to offenders of violence, we must recognize there remain many gaps in information about what works to rehabilitate offenders. Especially for younger offenders, we must do better in offering mental health and counseling services that foster positive behavior change. The interventions I have mentioned must be supported by community-level initiatives that benefit all. This includes, for example, improving the safety of the environments in which we live, work, and play. I want to reiterate that we all have a role to play at home, at work, in schools, and at church. In our day-to-day lives, we can demonstrate to family, friends, and neighbors, and our youth, that violence is never acceptable. We are not helpless. Violence is preventable. The strength of a public health approach to violence is its emphasis on the evidence for what works. When the stakes are high and when resources are limited, we must be guided not by hearsay and anecdotes, but by interventions that have been proven to work. Every individual has the right to live a healthy life, free from violence, and our efforts during this symposium will further drive our commitment to creating a safer and more prosperous Caribbean for all. Thank you very much.
Thank you, Mr. Chambliss, for a very detailed and whirlwind coverage.
Almost.
Yeah, and respecting the time as well. Very much appreciated. And I'm told that if we do very well in terms of time, we would have the opportunity to have some interaction from the audience as well. So if you develop any questions, we would seek to field a few of these. Well, we have a treat in store because the next contributor, beside being a good friend of mine, is part of the strong female leadership within CARICOM and our region. It gives me great pleasure to introduce, and it is my belief that she will share with us her perspective on a public health approach to violence in our region. It's my pleasure to introduce the Executive Director of CARFA, Dr. Joy St. John. Over to you, Joy.
Thank you very much, Minister Brown. And in trying to deal with the topic I was given, crime and violence, a public health approach, I want to give the Caribbean Public Health Agency perspective. And I start first by reminding people that the heads in the picture before you, and some of them in the room with you, are the same heads who led CARICOM out of what was supposed to be a death sentence for the Caribbean region, not only with reduced numbers of illnesses and deaths, but economic recovery, which was not expected. So I will then go straight into some examples of international experiences of the public health approach to crime and violence. The UK example is very intense. It's labor and cost intensive, relentless disruption and targeted action against highest harm, establishment of a single whole system approach. The Nordic approach also using the Danish prevention model as an example can be characterized as a comprehensive interagency model which emphasizes cooperation across a wide range of sectors. So what is a public health approach? And the first thing that we need to discuss, and I was really excited to hear so many heads and previous speakers refer to this, is that there demands a determinants of health perspective. What are the causes of the causes? And then, of course, there's prevention and treatment and care and rehabilitation, some of which can be mental health, not just physical health, as my classmate, Dr. Othello, will tell us later. And I'm going to put forward not just an approach, but a cost-effective, what I think will be sustainable approach, which mirrors something that was already approved by heads of government. And it's the 6 policy package framework for addressing childhood obesity, where regional and international agencies carry out their usual functions using their own budget lines for delivering programs which, when coordinated together, do address many of the regional level public health issues that will affect childhood obesity. But multiple sectors must provide coordinated action. The ambition of the heads is massive, and it needs to be, because the other individual, national, or non-coordinated, including many sectors, efforts have not done what is necessary, and crime has changed. And so I give you a snapshot of the sectors. There are others that I wanted, but I wanted to mirror what the agenda of this meeting has suggested that we do. And to make you realize that if we are having multiple sectors, there has to be some level of coming up to speed or even creating a new language, a new way of communicating, and most definitely a way of sharing information. But I would not want you to think that nothing has been going on before. Most definitely. And I give you here roles of the security cluster. Remember, it was the security cluster that worked to ring-fence the region during COVID-19. And here are some of the roles that CARFA, SEDEMA, CARICOM Impacts, and RSS can do and are doing to ensure that we have at least a regional level security response. And here I offer things like conducting ethical research. Many previous speakers spoke about the need to have the evidence. And I can also offer a themed CARFA research conference. We need to conduct surveillance and have indicators to support monitoring and evaluation, and also to ensure that the interventions that we propose are working. And remember, I said it's an ambitious vision. It's not going to be only at the regional level, but national level with communication and data sharing, community levels, and for the individual. SPD Chambliss spoke about several of the individual interventions across the life cycle that are going to be necessary so that we address things like recidivism, because a lot of the crime that is perpetuated is done by the same people. And so I come to my recommendation for a task force to develop this expanded, ambitious CARICOM regional public health approach, guided by the political declaration that will come out at the end of this meeting, involving key sectors as chosen by the heads. And there's a roadmap with immediate actions. Serendipitously in the Bahamas next week, the chief medical officers and the Council for Human and Social Development, the Council of Ministers will be meeting in the margins of CARFA's conference. And we need to put this, because it's a new paradigm, we need to put it to them and let them come up with the health policy support of the overall political agenda set by the heads. Next, we have to have the convening of the task force. Remember, these are proposed prime ministers. Research to define the current status of the region. Some of this has been ongoing in collaboration with the University of the West Indies, as led by CARICOM Impacts and supported by CARFA and others, many of the sectors that have been mentioned before. We need to develop a costed strategic or action plan, training, capacity building, and then monitoring and evaluation of the intervention. I'm done.
Absolutely perfect. Thank you very much, Dr. St. John, for really offering us the CARFA perspective, but also pointing us to some very clear recommendations with respect to next steps, which certainly will be taken on board as we formulate both a plan of action and even a declaration coming out of this particular symposium. We would like to move right along, and again, I thank you for respecting the time frame to perfection. We'd like to move right along. If there was just one early takeaway from this symposium, it is that we are not in this alone. We are not in this alone. And to share with us the Bahamas experience. We've had a bit of that already, but certainly from a very specific health and public health perspective, we have the benefit of a leading psychiatrist and consultant and advisor to the government and Prime Minister of the Bahamas, none other than Dr. David Allen, present with us. I now turn the floor over to Dr. Allen. I know he has some assistance as well in conducting his contribution. Dr. Allen, the floor is yours, and we're looking forward to your sharing of the Bahamas experience.
Thank you so much. A hurt child is a dangerous adult. I came across this nearly 30 years ago. We had the world's first countrywide crack cocaine epidemic. I picked it up in my office in Princess Margaret Hospital. 1982, there were 32 cases. 83, there were 59 cases. 84, there were 600 cases. That exponential increase indicated that my country is facing a very dangerous epidemic. Crack kills. It was the first drug that feminized drug addiction. In marginalized communities in the Caribbean, they're run by mothers and grandmothers. And so in the Bahamas, then, in our beautiful, serene country, through crack, women were ejected from the home, and many children were left to fend for themselves. I saw them. I went to homes where 5-year-old kids were taking care of 3-year-olds, 2-year-olds, and 1-year-olds. Mothers would come crying to me saying, how could I do this to my child? Some were secretaries. Some had great jobs. But a hurt child is a dangerous adult. That hurt child goes looking for other hurt children. Those hurt children come together, and guess what? They form what? Gangs. I've been going at this now for the past 55 years. I've seen it start like this, and now we have a gangsterized nation. From the prison to the high schools, the junior high schools, to the primary schools, to the community. But you know, hope is not lost. HOPE, helping our people everywhere. It's so important that we be balanced in our approach. I will carry to my grave many things I've seen. That's beautiful, because beauty means you still have to see the beauty no matter how bad things are, because there is still love in the world. And so, if you look at our graph of homicides, in 63 we had 5, in 85 it went up. But what I found was that after discovering a number of treatments for the individual crack users, we had a tremendous outpouring of treatment programs. I found out I didn't know how to deal with the social fragmentation in our communities. Grime and crime was everywhere. Kemp Road, a wonderful community, was now being destroyed. Bain Town, Meadow Street, The Grove. And so I came up with the idea that if I could find, having been trained in group psychotherapy, a space where I can get a group of people who had experienced children who were gone through the mess, then maybe I can understand it. I found 7 women. They all had lost a child to murder, but they also saw, they think, the murder of the child walking by the house at night. They were terrified. They were ashamed. I said, can I meet with you? They said, why? We don't want your psychiatry. Well, let's forget psychiatry. What can we call ourselves? They said, the family. I love that. It's neutral. What should we do? Let's tell our stories. You tell me your stories, and I'll tell you my story of trying to learn as a soft, scared Bahamian to work with you. It's amazing what happened. Within 1 year, the groups had grown from 1 to 3. In 2 years, 30 groups throughout Nassau, including the prison. I was able to understand what was happening. Our nation was shame. Yes, there's violent crime, but the pathogen is shame. S, self, H, hatred, aimed at who? Me. And I realized that not just the hurt is shame, David Allen was as well. I remember my time training at Harvard. Malcolm's ex-sister taught me something. He said, David, why are you so soft? You need to get some spa. I said, yes, Jackie, you're right. She gave me some lessons. Then I went to East Boston. There's a guy there called Jim Snelders. I tried to treat his opiate addiction. One Friday, I waited for him for 3 hours. He came late. Well, he says, Dr. Allen, you know something? You and I are just alike. I shoot up on heroin, but you shoot up on ego. Oh, what? Yeah, you're an addict as well. Wow. Shame is the gap between the expression of what we want and what we have. I realized that I was a shamed individual as well. Shame always produces separation. And in the Caribbean, we have so much talent, but we live separately. We don't get together and help each other. We could solve a lot of these problems. We could help those hurt, shamed children, but our shame blocks us. That gap is so big. What I am. But you know, as we get older, the gap increases. I'm old now. The gap is coming. But you know, fellowship, community, communitas fills the gap. We could come together. You can break 1 stick. It's hard to break 10. We can work together. And so I got together in Nassau with the family concept. Michael Broadman from Trinidad, God bless his soul. He would come every 2 months and be with me. He loved Friday nights, fat night. His drink was always what? Bacardi and ginger ale. But he helped me. People came from the States. The Archbishop of Jamaica, Burke, came to the Bahamas, and he also blessed me. Pastor Roach, and they all came around me. And I put my office in the convent. This is a charity convent. I didn't know. When I knocked on the door, they said, welcome, St. Joseph. Well, I'm not Catholic. But they gave me a nun each day who sat in my office doing contemplative prayer. The world doesn't know that. But I can tell you, check our hospitals today, crack is virtually gone. Yes, there are impossible situations, but we do have now a shame problem. And so what I decided to do was to try and form the family, which is a shame buster. And in the family, we realized to handle shame, you have to learn how to grieve. You see, you can only love as deep as you grieve, and you can only grieve as deep as you love. So grieving equals love. And if you can't grieve, you can't leave. So if the gap we face in our life, whatever it is, if we can't grieve that gap takes us out. What a shame. I think Derek Walcott said it best. He said, self-contempt is hard to eradicate. If you live long enough, walk up your own stairs, look in your own mirror, and the image you see of yourself, you either say, I love you, or to hell with you. But you will have to face your shame. It started in the Garden of Eden. Remember Adam and Eve? They disobeyed. They were afraid, they were naked, they were ashamed, but they covered themselves with fig leaves. Shame always creates vulnerability, but seeks cover. And so when the transcendent love came down to them, Adam said, go away. In other words, shame rejects the love it craves and walks toward the rejection it fears. Let me say it again. Shame rejects the love it craves and walks toward the rejection it fears. W.H. Auden, the poet laureate of England, we would rather be ruined than changed. We would rather die in our dread than climb the cross of the moment and let our stupid illusions die. I've seen that in my lifetime. I've seen guys who in the gang, they meet with me. Doc, I don't like this, but I can't stop. I came early to my meeting one day in East Street. I sat down. This nice-looking guy came. Hey, you David Allen? Yeah, I think I am. He said, look, I'm a killer. Wow. I'm sorry, I can't fight. I started to get up to walk to the door. He said, don't run. I'm going to kill you. I said, what do you mean? What's this about, man? He said, I've been watching you for years. Always wanted to talk with you. Then he started crying. He said, you know, if I had a dad like you to talk with, I killed a darn bicycle. And the bicycle don't work. So I said, look, man, the family's starting in a half an hour. No, Doc, don't mess with that. No, Doc. I watch you, I'll join you later, but not now. Just killed. I developed a theory called the contemplative discovery pathway and tried to show how in the family I can be a shame buster. At birth, the outer circle, the child needs 3 needs: safety, love, and empowerment. They're the instinctual needs, but guess what? They're the dreams of all our life. We want to be what? Safe. We want to be loved, we want to be empowered. And safety requires the child has to be seen, they have to be soothed, and then they're safe. But then that child starts a journey. The child gets hurt. If dad's not there, if mom's not there, the shame takes place, self-hatred aimed at me. But wherever shame goes, it's a shameful self. This is important to recognize, because the killer on the street who lives by respect and survival is totally different from the Tom Jones at home. I've met them all. They meet with me sometime. Tom Jones at home goes to church with grandma. But on the street, he has to what? Survive and have what? Respect. He's been groomed for about 6 months to 9 months. And these guys are good at it. They help the mummy groceries. They give him Nike shoes. They give him shirts. But after 1 year, they give him what? The gun. I've talked about 5 guys who got their gun. They were ecstatic. They said, Doc, now I've got it made. NASA only belongs to me, because with my gun, my shiny friend, when I walk, why are you so excited? Man, I check all the guys who hurt me. I can knock them out if I want. And Doc, what you have, I can get. Gee, this gun. The gun is the new drug. The gun is the new drug. And Andre Chappelle, who was homeless for 30 years, I treated him when he was 15. I watched him go down into homelessness. I'll show you his picture at the end. He came back just before he died. But his dying words to me was, David Allen, the gun is the new drug. He was so darn right. And so we catch the shameful self. The shame is hard through grieving, but that shameful self is tough because they're surrounded with multiple layers of gangs. There's protection. They tell me when they killed the first time, they warm it all night. But after 5 times, they say, Doc, it's like drinking water. Human beings get used to anything they do regularly. And I realized, wow. But yet I've seen gentlemen and ladies move through that shame, false self barrier to become what? Authentic. And find solitude and communion. One of my guys was a tough guy. His face was really blown off. This Christmas I said, how did you do, buddy? He said, you know what? I had a great Christmas. Why? I was able to be by myself and enjoy it. For the first time, he said, I enjoyed solitude. Isn't that beautiful? As Kevin would talk about, that was my researcher, and I can't move without Kevin. And please, you know, this is a connection thing. She does the work, and that's hard work because you've got to have evidence-based. You can't do this kind of work without evidence-based. Please give her a hand because she's very humble, but a great researcher.
In the interest of time, I'll just skip through a few slides, but what he wanted me to discuss with you is the results of our trauma study, which we did on the cusp of the COVID-19 pandemic. And what we did is we hypothesized that the participants in our family group program, they were traumatized, and because they were traumatized as children, they engage in at-risk behaviors as a result. So what we said is that participation in our group therapy program can counteract this traumatization that they received as children. We collected data, and our sample was a little bit over 200, and what we tested them with was a Beck Depression score, something called an Adverse Childhood Experiences Questionnaire, an anxiety screen, and a post-traumatic stress disorder screen, along with an Allen resocialization screen. And what we found was that 11% of the participants in our group therapy program, they had moderate to severe depression. 23% had mild anxiety. But what was most important was that 44% of them had adverse childhood experiences. And this adverse childhood experiences was developed by Felitti and Anda in the 1980s. It was a collaboration between the CDC and Kaiser Permanente, and what they said was that if you can answer yes to 4 or more questions about how your life was before the age of 18, it was an indicator of how many physiological and psychological effects you would have in your later adult life. So in our sample, 44% of our participants had significant adverse childhood experiences, including 44% that admitted to being physically abused before the age of 18 years, and 23% who admitted to being sexually abused before the age of 18 years. Life experiences play out in the function and the malfunction of our bodies. That was the premise for them developing the screen. And there was also a correlation between adverse childhood experiences and at-risk behaviors. So in our sample, again, we had 38% who had significant adverse experiences and who admitted to alcohol consumption, and then 32% who admitted to drug use. What we also found was that because of these adverse childhood experiences, 84% of those in our sample also had post-traumatic stress disorder. And at the end of giving them the screening tools, we also gave them one to measure resocialization, because we wanted to see if our group therapy program worked. And 98% of those tested with our resocialization scale proved to be resocialized.
Okay. Yeah,
Can I just end with one slide to honor this gentleman? That's Andre Chappelle. Came an animal, put in the family, came back, died 3 years later. He told me, Doc, the new drug is the gun. Thank you.
Thank you very much, Dr. Allen. I must say I was very conflicted between the clock and the respect for the voice of practical experience. So thank you very much for that very enriching presentation, and to your colleague as well. So I will now turn over to the Ministry of Health. So we will hear from
The machine. The machine. The clicker.
Am I next?
Yes. Yes. I think that last presentation was a useful segue into the next presentation from the Ministry of Health. So we will go to the Accident and Emergency team, where I am convinced there is a large volume of daily information, brackets evidence as well, that flows through those premises, and a large repository of experience that our professionals have in the casualty departments, A&E departments, that this symposium, our leadership and other stakeholders would benefit tremendously from. I'm very much looking forward to this presentation. Dr. Sinanan, you're a very young man, so you're not going to get the same latitude as Dr. Allen. With those few words, I introduce you, and please proceed with your presentation.
Thank you very much, Dr. Brown. Distinguished ladies and gentlemen, good afternoon. My presentation today looks at the emergency department perspective to violence here in Trinidad and Tobago. Okay. The aim is to just look at the role of the hospital in a public health approach to violence reduction. The objectives is to look at the scope of the problem, look at the data, how many people are actually coming into our emergency departments for violence. Just briefly about the care pathways that we provide to these persons, what data we capture, and provide just 2 solutions from our end. Okay, slide 3. This is ambulance transfers from Trinidad for the period 2019-2022. And you will note it's about 70 to 75,000 persons per year, and about 2,500 to 3,000 of those would be moved for violence, which is roughly about 3 to 4%. The total assault responses remain fairly constant, and you would note a slight dip in 2021. The sexual assault numbers here would represent persons who would have called the ambulance because they would have more likely been exposed to additional physical trauma. 2021 also appears to show a drop in the number of assault numbers, but showed a rise in both gunshot wounds and stabbings. And you will note, and this was highlighted earlier today, that gunshot wounds appear to be outnumbering stabbings. Right. Same data is presented in pie charts. On the left shows a fairly consistent number of trauma each year. On the right shows that the majority of violent injuries that we see are common assaults. I'll now cover the persons who present to the 3 main emergency departments in the country, starting with Eric Williams. You would see between 2,500 to 3,000 persons coming for injuries due to violence. Unfortunately, we weren't able to disaggregate this data to show the different types of injuries. We did manage to get some disaggregation for Port of Spain with gunshot wounds, stabs, and sexual assaults, showing there were 1,563 persons that presented to that facility. At San Fernando, okay, we went. Okay, for the year 2022, we had just around 2,000 persons coming in, and the same trend that gunshot wounds outnumber stabs. If we look at attempted self-harm, we have data from 1 county, and it's 2 to 3 cases per month. Right, so this is suspected sexual assault that is not associated with additional trauma presenting to the primary care system. And this is 1 county with a population of about 240,000 people. So it's 53 to 56 cases per year. Now, just a little bit of information about San Fernando, where I spend most of my time. We had a system of injury surveillance data capture since the early 2000s. Over the years, that has since been replaced now by a computerized database where we capture clinical as well as epidemiological data. It's still in its infancy, but we're starting to get some information about it. And why is the information important? And this, we would have gone through this by a number of persons over the day so far. But just one quick example from San Fernando, where a couple of years ago we noticed a high incidence of firecracker-related hand injuries over Diwali. And our team at South, we started a social media lobby amongst our contacts and friends, and that grew into a bigger program where we actually, it's engaging the attention now at the minister level and higher levels. So the point is these systems works, this advocacy works, a data-based approach works. The last 3 examples of international programs that have been very successful because they were data-driven. Right, so what happens when we see somebody with violence? We deal with the clinical part. We undertake our mandatory reporting requirements. Suspected domestic violence and violence against women, we do activate social workers and police and safe houses and so on. So that works, and although I think a lot needs to be done to improve that, it works. Where I think we have a challenge is where we have male-to-male violence. Those guys, honestly, we patch them up and send them back out. There's no follow-up, there's no counseling, and that is, I think, is an area that we really need to work on. Solutions and recommendations. If we follow primary prevention, secondary prevention, tertiary prevention, it all starts with data, and this point has been made over and over again during the course of the day. So I am suggesting a national system with a separate subset to cover all the groups of violence that we are focusing on: interpersonal violence, sexual assaults, adverse childhood events. Doctor spoke about that just now, and the significance of it. Gunshot wounds, violence against women, elder abuse, self-harm. Having a ready database is the way to go. When somebody comes in, we should be able to start a response within the emergency department. We can call it a violence response team, we can call it a unit, but the point is it starts from the emergency department. It should be very well coordinated, and it should come and meet the person there and then take the response all the way back into their homes. Because we are very much aware, and we have gone through a lot of this before. Some training for the healthcare workers, and this has been advocated as well, in recognizing violence and violence prevention. And in summary, I would especially like to focus on that point about the adverse childhood events. I would like to see a better system put in place for that, because we know it's a big factor in school performance, we know it's a big factor in future violence, and even physical health outcomes are impacted by adverse childhood outcomes. Thank you all very much.
It's a lot of data.
Thank you very much, Dr. Sinanan, and really adding to the data content, enriching the symposium from the accident and emergency perspective. Well, if you spend enough time in politics, you would know the importance of mental health to societies in our region. It gives me great pleasure. Another component of the Ministry of Health's very important contribution to this symposium would be to share some further detail on the mental health perspective. We have a very vibrant, well-known and hardworking Dr. Hazel Othello to share with us some of that particular perspective. With no further ado, please, Dr. Othello, you can proceed.
Thank you, Minister Brown. Good afternoon, distinguished ladies and gentlemen. I'll go very quickly through this definition just to make sure we're all on the same page and we all mean the same thing when we talk about mental health. So this is just the World Health Organization's definition that doesn't speak to the absence of a mental illness. It's more holistic than that, and it speaks about our ability to realize our goals, to cope well with situations, to work and produce, and to make a valuable contribution towards our society. It's not just about the absence of an illness or challenges or adversities. And this diagram kind of illustrates that, in that it's a pyramid which reflects the different mental states that we can all experience. At the bottom of the pyramid is where I would assume that most of us in this room would currently sit, where we're okay, we may have challenges that we're facing, but we're coping with them and we feel pretty okay about things. As we face more stressors and as our coping ability is challenged, we move up the pyramid to different states, and at the top of the pyramid, you see the area of mental illness or mental disorders, and that's where we talk about the diagnoses that many of us would be familiar with. I put that graph up to lead into this slide, because this slide speaks about the psychological impact of violence, and I think that's an area that many of you are interested in. People who experience repeated or severe trauma from violence can find themselves experiencing the various levels of this pyramid and sometimes find themselves developing illnesses such as depression, post-traumatic stress disorder, substance use disorders, sleeping and appetite disorders. They experience symptoms of mental illness, and they can actually develop mental illnesses. So it's very important for us to look at this situation, not just from the crime prevention point of view for keeping the numbers down, but also in terms of taking care of those who are affected by it. And in that regard, I got some information from the Trinidad and Tobago Police Service. They have a victim and witness support unit, and they provided some very valuable data. They've been in operation since 2008, and since then they've seen over 30,000 victims. Their 2022 data shows us that for that year, they saw over 3,000 new victims. In terms of their interactions with the public, they saw over 5,000, they did over 5,000 in-person sessions, and again over 5,000 virtual sessions. So they've been quite busy. And they also do group interventions and community outreach activities. So that shows us that, you know, the law enforcement arm in Trinidad and Tobago is not just in the business of preventing and solving and prosecuting crime, but they're also in the business of taking care of those who have been affected by crime. This graphic just shows us the types of crimes that have resulted in the Victim and Witness Support Unit interacting with the public. Domestic violence, as you would expect, is right up there. Family disputes follow. And of course, homicide makes a significant contribution, followed by sexual offenses. And what used to be called children beyond control, but is now called children in need of supervision. The last graphic from the TTPS shows us over the years from 2008 to now, the increasing number of persons that they've been having to see as a result of people's trauma produced by crime. The other side of the coin is the link between mental illness and violent offending. And I'm not just talking about mental health in a holistic way now. I'm speaking specifically about people who develop diagnosable mental illnesses. It's important to know that mental illness does not necessarily mean criminality. In other words, the vast majority of people who develop a mental illness will never commit a violent crime. They're not generally violent. And we have to remember that, because when we lose sight of that, we increase the likelihood of them being subject to stigma and discrimination. So it's very important for us to realize that there is an increased risk for violence produced by some mental disorders, particularly those associated with certain symptoms such as paranoid thoughts and what we call command hallucinations, where you hear a voice telling you to do something and you feel that you must act on that voice. But the illness that causes those types of symptoms is schizophrenia most commonly, and that only affects 1% of our population. And not everybody with schizophrenia will commit an offense. So it's really small numbers we're talking about. We also need to remember that most violent crimes are not committed by mentally ill persons. We're not saying that mental health does not have a role to play, because if you remember that first definition that we started out with, if you're not making in a state that allows you to produce, to make a valuable contribution to society, to deal with stresses and things like that, then you do not fit the World Health Organization's definition for being mentally healthy. So let's look at what kinds of risk factors we need to be thinking about as we address mental health and crime. We need to make sure that treatment is available. If we don't have adequate treatment, symptoms linger, they don't get resolved, and they increase the risk for crime and violence. We have to look at comorbid substance abuse, as was mentioned by several previous speakers. Some mental disorders are associated with intellectual disabilities or cognitive impairment, and that could reduce judgment and cause certain types of crime. And of course, as many people have said before, we have to deal with the social determinants of health. So how do we break those links? Very important, we must have multidisciplinary approaches. We must have training for mental health professions in the whole area of risk evaluation and risk management. If you don't know how to identify what makes your patient more likely to commit a crime or to be violent, you're going to miss it. So we have to be doing that. We have to be able to access all the resources that people need, particularly people who are recovering from mental illnesses, so that they can recover well and be reintegrated into society. And of course, we can't forget the offenders who have mental disorders. Make sure that the types of rehabilitation strategies that work are available to them. And last, multidisciplinary collaboration for the provision of care to crime victims is very important. Thank you for your attention.
Thank you very much, Dr. Othello. Unfortunately, I am not able to keep my promise to open up the floor for interventions from the gathered audience, simply because we have run out of time completely. All that remains for me would be to thank the members of this distinguished team that have helped us to plunge a bit deeper into the public health perspective and focus on violence and crime. We've had quite a span from the mental health to accident and emergency, public health policy at the regional level. And I believe we've also had some data presented that would be very useful for us in formulating the next steps coming out of this symposium. Perfect. The presentations are available and published and can be easily accessed. We will provide the information as to how they can be accessed. So thank you very much. Thank you for your patience.
Thank you to all the participants. I kindly ask traffic lights, sorry, we're going to do a little carnival route, Dr. Sinanan. Could you exit this way? We'll call this the North Stand, and just head in this direction, because we need those lovely devices called microphones that you have on in order to mic the next group. So please, ladies, gentlemen, please make your way stage left. Thank you. And as we keep the program going, ladies and gentlemen, it's Jamaica's turn. Indeed, Jamaica is here with us this afternoon, and it is indeed a pleasure at this time to invite to share remarks the Prime Minister of Jamaica and lead head with responsibility for external trade negotiations at the level of CARICOM. Please welcome the Most Honorable Andrew Holness.
The Honourable Philip Davis, Prime Minister of the Bahamas, Dr. Keith Rowley, Prime Minister of Trinidad and Tobago, other colleague heads and representatives of community institutions, ladies and gentlemen, let me express sincere appreciation and gratitude to the government of Trinidad and Tobago, the CARICOM Secretariat, and the other regional institutions, including CARFA and IMPACT, for coordinating this meeting. Colleagues, we live in a high violence region. If we use murder rates as an index for violence, the Latin American and Caribbean region would be approximately 15 murders per 100,000 of population, while the world average is approximately 6 per 100,000. For the Caribbean, this runs counter to our global image as a zone of peace. In the last 3 decades, the CARICOM region has seen an increase in crimes and, in particular, the use of fatal violence. Violence generally in social interactions and violence in crime particularly has grown in scale over and above the existing capacity of our respective state infrastructure. Aside from the increase in the volume of violence, there is also a change in the nature of violence and crime, for which our law enforcement, justice systems, public health systems, education and social intervention programs are not fully equipped. The truth is, violence and crime, particularly murders, have become more than a community-based or citizen-level threat for which a localized or single-entity response would be sufficient. Crime and violence can no longer be seen only as a policing problem. We must acknowledge that in nature and extent, crime and violence has become a public health epidemic and an existential threat to the state, meaning that the nature and scale of crime and violence is so extensive and insidious that it is impacting the allocation of public resources and the national economy. Governments must now consider increasing their national security budgets relative to all other needs to which they must attend. In the last 6 years, Jamaica has tripled its capital expenditure on national security. Tripled. Crime and violence is undermining the ability of the state to deliver services, and it weakens the confidence of the citizen in the state. Crime and violence are now a systemic threat to the proper functioning of the state to enforce its laws, deliver justice, protect its borders, and secure its revenues. When criminals routinely seek to kill or intimidate witnesses, they weaken the ability of the justice system to convict them. When criminals deliberately seek to befriend and enlist the protection of police officers and other public officials, they compromise the ability of the police to effectively enforce the law. When criminals seek to infiltrate our seaports and airports, they compromise the ability of the government to control our borders. But the greatest threat to the state and citizen security is the prevalence of criminal gangs organizing the use of violence against the citizen and the state in furtherance of criminal enterprise. While these gangs may not have political motives, they are intent on weakening states and governments to create space for criminal activity. They use corruption to weaken the state and violence to terrorize and spread fear among citizens, which reduces confidence in the state to protect citizens, thereby reducing the legitimacy of the state. Gangs using organized violence amount to criminal terrorism, and our law enforcement and justice system must adapt to this new reality. Crime and violence are also damaging the reputation and brand of our countries in the global marketplace. all of us here rely on our brand for tourism, the Caribbean, a safe place to visit. From a public health perspective, speaking from the Jamaican experience, which aligns well with what was just presented, physical assaults, that is the intentional use of violence in domestic disputes, intimate partner affairs, in the disciplining of children, corporal punishment. In business dealings, in Jamaica, we're seeing an increase in the use of violence in land disputes, for example. And of course, the increased use of violence in criminal acts. A robbery is now committed, aggravated with assault. Quite unnecessary, but the robber has a gun, so why not just use it? So the intentional use of violence in all these social interactions and in crime cause more trauma and loss of life than most diseases. And that is a fact. In the initial stages of the COVID pandemic, all our countries instituted emergency measures. And at that time, the incidence per 100,000 of cases of infected persons were well below what the murder rate was at the time. But we employed emergency measures. Our governments are, I wouldn't say reluctant, but we have not used, in many instances, the emergency measures, which are justified by the conditions that now exist with crime and violence. Crime and violence would be in the top 10 causes for seeking medical attention and a leading cause of deaths of victims. This is compounded by the mental health trauma to loved ones and persons who witnessed the violent act. The widespread normalization of violence generally in social interactions and as a means of conflict resolution, the extensive use of violence in crime, and the evolution of organized violence by criminal actors to capture communities and even states to create space for criminal enterprise is now at a level where it is no longer a citizen-level or community-level threat. It is now an existential threat to the effectiveness and legitimacy of the state. If this is the case, what should we do as a region? If it is that we're assembled here today because the heads feel that crime and violence has now reached to that stage where it is not only threatening the re-election of governments, but the very stability of the state, what should we do? Well, the region needs to recognize that the activities of criminal gangs, criminal enterprise, in creating an atmosphere of fear and terror among entire communities is tantamount to criminal terrorism. Feel free to clap if you wish. There is an internationally recognized and accepted approach to deal with individuals and organizations classified as terrorists. A similar approach must be utilized to deal with domestic criminal terrorists. The fact is that our region's laws and jurisprudence were generally not designed to treat with criminal threats of this nature and magnitude. In other Commonwealth jurisdictions, such as Australia and the United Kingdom, jurisprudence has played a critical role in regulating the access, possession, use, and trade of illicit firearms, which has resulted in greater public safety and security. Furthermore, the existence of robust laws, timely prosecution of cases, and the exercise of sound judgment in sentencing builds a belief in the justice system and delivers the cumulative effect of deterrence while balancing the rights of citizens in free and democratic societies. We must therefore reform our legislation to match the growing sophistication, scale, and nature of the threat. Our jurisprudence must incorporate measures which will support enhanced security operations, which will support the use of emergency powers, and which will support preventative action to disrupt and control the space in which criminal actors operate before they commit the act of violence. Friends, this epidemic of crime and violence has been exacerbated by the uncontrolled influx of illegal small arms and light weapons. I call it an accelerant. I so liked the description given by the professor when he said, guns are the new drugs. They are an accelerant. An act of violence that may not result in the taking of a life without the presence of a gun. With the presence of a gun, the probability of taking a life doubles. In Jamaica, in the last 10 years, we have seized 8,036 illegal firearms. And I wouldn't tell you how many I think are still in the hands of criminals. Multiples of that. But the really important figure is that 12,641 Jamaicans were murdered by illegal firearms. Criminal organizations and gangs have been able to acquire illegal firearms with ease, even though they are not manufactured in the region. As a matter of regional security and foreign policy, we must coordinate and strengthen our efforts bilaterally with the United States and multilaterally through the UN system to secure greater control over the illegal export of small arms and light weapons to our region. This regional approach to prevent a dangerous substance from leaving our shores to get to the streets of North America is taken in the war on drugs. That's what it is. We spend effort, we spend time preventing an illegal substance getting to the shores of another country. A similar effort must be placed on ensuring that illegal guns don't leave their shores to come to our countries. Our children are being killed. Our young males are being killed with guns exchanged for drugs which head to North America. Our children are just as valuable as the children in North America. There has to be equal energy, effort, and attention paid to preventing illegal guns coming into our country as we pay effort, energy, and attention in preventing illegal drugs going to their country. In fact, the war on drugs will continue to be ineffective unless there is an equivalent and consummate war on guns. The foundation of any economic and social progress is security. The rule of law, public safety, and national security are all threatened by this ever-growing crime and violence threat. Governments must respond by increasing their investments in national security to build capacity. As Caribbean nations, we oftentimes see ourselves as small islands, that the threats that are affecting other larger nations, those threats would probably not affect us until they are at our doorsteps, until they are overwhelming us, which is effectively what has happened in the last 30 years. This crime and violence threat that we face didn't happen yesterday. It didn't happen last year. It didn't happen a decade ago. It started over 30 years ago. But we never took it seriously. We never looked at it with the level of sophistication that we needed to have. And the truth is, sometimes we are trapped in our inherited archaic laws and frame of thinking, which we need to break out of and create our own laws to deal with our own circumstances. So, while I do call upon the United States and other countries to take responsibility for the illegal export of a dangerous weapon, which is the equivalent of drugs, I also call on our governments to put our money where our threats lie. We have to increase our capabilities and our capacities to scan the goods coming through our ports, to buy the offshore patrol vessels, to have the maritime surveillance. We cannot rely on foreign countries to tell us what is moving in our waters and what is coming in our ports. They're only going to tell us what's in their interest. We must act in our interest. So one of the things we must do regionally and individually is to increase our capacity to control our domain. A complete solution statement requires focus beyond the symptoms which manifest as crime and violence to a far deeper analysis of the social, cultural, and historical factors that drive aggression, hate, lack of respect for authority, low socio-emotional regulation, antisocial behavior, and lack of the value for the inviolability of life and for the sanctity of life. Why are so many Caribbean citizens choosing to use violence to resolve conflict? Why? Why is the propensity to use violence so high? Clearly, social intervention and support programs must be reconfigured and scaled up, and our education system must be reimagined. Reimagined. We really have to rethink our education system to promote the values and skills needed to develop a pro-social, pro-growth, creative, and productive citizen. The epidemiology of the social demographics of crime and violence in Jamaica shows that the perpetrators are 90% young males. And the victims are also largely young males. So yes, we have to take a grand approach to our social intervention and a grand approach to reforming our education system and our social services. But the evidence of the public health approach shows that the immediate attention must be towards our young men. Something has gone wrong in the socialization of our young males in the Caribbean. And public policy needs to respond to that. We need to respond to that in how our young males are parented. We need to respond to that in how our young males are taught in our schools. And we need to respond to that in how our young males are transitioned into the workforce. Ladies and gentlemen, before I close, one of the final things that need to happen in the region is that there has to be political consensus on what to do about crime and violence. The solution arc for dealing with the problem extends beyond the political cycle. In simple terms, the solutions are long-term. The political cycle is short-term. And therefore, there has to be a long-term pathway for the solutions to work. It means that you must have political consensus. You must take crime and violence out of the competitive political space and place it as a national priority, so that we can give our citizens a long-term pathway. There is no short-term solution to this problem. There is no flip of a switch. Well, there is, but we're not prepared to use it. So, ladies and gentlemen, in closing, I feel optimistic about this conference. Things have been said which needed to have been said. The leaders are thinking similarly. And I think that solutions are going to emerge over the coming weeks and months. Again, let me thank PM Rowley, the CARICOM Secretariat, and the team for putting this together. Thank you.
And our thanks to you, Prime Minister, the Most Honourable Andrew Holness, the Prime Minister of Jamaica, and lead head with responsibility for external trade negotiations. The subject area next is transnational organized crime, challenges with small arms and light weapons in Latin America and the Caribbean. To present on trans-border crime, the French Caribbean experience, is the President of the Collectivity of Martinique, His Excellency Serge Leshimi. The slide presentation will be in English. There will be a narration in English. His Excellency will present in his native tongue.
Monsieur le Premier ministre,
Mr. Prime Minister of Trinidad and Tobago, Secretary General of CARICOM, the Chair of CARICOM, dear colleagues, Prime Minister of Barbados, the Ambassador of France who is present. I'm really honored by your invitation. In Martinique and Guadeloupe, we are not members of CARICOM, but we have a deep desire to come home to this common structure. It is not a whim. It's not a desire to participate simply for participating, but it is a desire that is being shared now by the French authorities to share our problems and to organize the development that we need, and to not be strangers to our shared geography. The subject that we are addressing today is fundamental, and it shows that Martinique, Guadeloupe, and French Guyana are affected by this traffic of weapons and drugs. I believe, and I've heard the Prime Minister of Jamaica say, I share his belief, that there are things at stake that we can solve, because if not, we risk destabilizing the democracy in Caribbean countries by the disorder brought by the traffic of weapons and drugs. And in my opinion, we have to legitimize and attack the democratic basis, which is challenging our development. Second observation, yes, we are in the Caribbean. We have a specific geography. Our geographical position is an advantage, but it is also used by drug traffickers and arms dealers. We are between Europe and the Americas, and I'll give you the example of Martinique, Guadeloupe, and French Guyana to show you that we are becoming a logistic platform for transferring drugs to Europe. The statistics are very concerning, and we have to find a way of responding to this issue together. And this is what justifies our presence and our integration in regional organizations, including CARICOM. This integration will allow us to amplify the cooperation that exists, because today the French forces are carrying out widespread actions to seize drugs. We have a unit that has been set up to fight drug trafficking, and tons of drugs have been seized in the Caribbean Sea. And this is extremely important. We are working to organize cooperation with shared actions in the field of justice to monitor our coastlines and monitor our waters. This cooperation is fundamental. And I can give you a few figures to show how this can destabilize progress. There's a very important element and it's the state's capacities to deal with the financial stakes.
Cocaïne, entre 2021 et 2022.
In 2021-2022, we seized 12 tons of cocaine, and the military forces were responsible for the seizure. The army, which patrols the exclusive economic zone that includes Trinidad and Tobago. And this seizure of 12 tons included seizures in maritime areas, on land, and in Europe. This corresponded to 360 million euros. The sale of these proceeds in Europe.
Disons que les saisines ne concernent que 10% du trafic qui se fait entre les Amériques du Sud, la Caraïbe et l'Europe.
Président, on va vous demander d'enlever le casque parce que ça crée pas mal d'interférences sonores pour nous ici. Est-ce que vous pouvez éteindre? Désolé. So we've only intercepted 10% of the drugs trafficked through the West Indies. And the value of these drugs is between 5 and 7 million euros. And it's sold in Europe for 70,000 euros per kilo. The global market, which arrives in Europe, is between 3 and 5 billion euros. And why am I giving you these figures, friends? It's simply to show you that this meeting today, this symposium, is fundamental, because in the face of such a reality, there are direct consequences on the functioning of our different countries and our different societies. We can't lose hope. We can't lose our vision. We can't abandon our hopes and change our attitude to defense. We must federate our judicial, financial, structural responses and establish a cooperation system with all the countries of the Caribbean. And this is why Martinique, Guadeloupe, and French Guyana, with our national authorities in France, have committed, notably with St. Lucia and Dominica, to a series of discussions to build a common policy to combat drug trafficking, and especially the traffic of cocaine. The situation is even more complex in French Guyana, because in French Guyana, they use very specific methods. They use mules. The human body serves to transport drugs between the Americas and Europe. In 2021, 512 mules were arrested with 1,260,000 kilos of cocaine. This human trafficking is paid by up to 3,000 to 10,000 euros per trip. And the market in French Guyana is estimated at up to 40,000 euros per kilo in Europe. Quite often, this drug trafficking is accompanied by weapons. And the traffic of weapons has become a serious issue in French Guiana, Guadeloupe, and Martinique. In Martinique, we have seen an explosion of murders and of 30 persons who were murdered, over 29 were killed by guns. In Guadeloupe, of the 30 homicides that were recorded in 2022, 29 were due to guns. Attempted homicides are 13 times higher in Guadeloupe and Martinique than in France. In French Guiana, there were 47 homicides in 2022, with an increase of 51% from 2021 to 2022. There are therefore this transnational organized crime and a progressive establishment in developing countries. And that is why I say that violence and crime are also based on inequalities and precarity. And that is why I think that we absolutely must adopt responses that are adapted to our reality. If we strengthen our actions in terms of combating drug trafficking, especially on the Caribbean Sea, in consultation with CARICOM. There are existing contracts, conventions, treaties, but if we set up bilateral agreements, we will be able to adopt common policies to share information. We must also adopt legal policies. And some of these suggestions were already made by the Prime Minister of Barbados, who told us that we must create common judicial responses in the Caribbean. Of course, I know that this will be more complicated, but I do think that regional judicial treaties should be possible. We also think that it is important to have judicial cooperation that is much more powerful, and that is why we have asked for a magistrate that is specialized in cooperation who can work directly with the Caribbean countries and the countries that are close to Guadeloupe, French Guiana, and Martinique, and with countries that are also involved in this traffic. I say it as I think it. I don't think we have to respect the sovereignty of states, but there is a responsibility, a moral and political responsibility among those who manufacture arms and who allow them to be exported massively throughout the Caribbean. This is not acceptable. And this is why the figures are clear. 90% to 95% of guns that are found in Martinique, we're not speaking about small weapons, small guns. We're speaking about heavy guns that are used in wars. They come primarily from the United States, but also from Venezuela. And the traffic is carried out at sea. our shared responsibility is crucial, but we have to involve those countries. And in this context, we must amplify cooperation by including countries, French-speaking countries, so that global policies do not exclude these countries that are directly affected by the causes of violence and crime. I was asked to speak about the trans-border crime. And the two examples that we have with St. Lucia and Dominica, our neighboring islands, but even beyond that, if we look at the other islands in the Caribbean, we have to set up an exemplary cooperation. The fight against crime and against drugs, the fight against the introduction of guns cannot stop at a defense policy. It cannot be limited to a policy of repression. We cannot simply look at judicial responses. We must include, and this has been said before on several occasions, we must adopt a policy that allows us to see human beings and individuals in a different fashion, so that from the youngest age, these individuals do not find themselves involved in drug trafficking. Allez-y.
C'est bon?
Oui, allez-y. So, these practices lead men and women to very abusive situations, but I've never seen a child born delinquent, killer, assassin, trafficker. And I think honestly that society creates the conditions for abuses and excesses and specific situations that amplify the victimization of those who are in unacceptable situations. In this context, in Guadeloupe, Martinique, and French Guyana, but I've also seen it here, we also have a humane approach where we must have the support of family policies and organized rights. We must protect those who are excluded, the most defenseless, with policies for job creation, for cultural mediation, to have local healthcare services, community services. We must adapt our education to our realities in our different countries by giving a second or even a third chance to those who are victims of exclusion, because exclusion and misery are not a choice. They are the consequences of our history, the consequences of economic systems that produce unemployment, that produce exclusion. And these are the values that we must reinstate. And several ministers have said it before me. We cannot keep we cannot continue increasing national security budgets. Because doing so would establish relations, very complicated budgetary relations that are difficult to maintain. We have to create a resilience policy, a social, cultural resilience policy that goes beyond all of the policies that we put in place to ensure the security of our countries. Honorable Prime Minister of Trinidad and Tobago, at the beginning of this event, I was a bit doubtful. I saw the extent of the subject and I thought,
it is the illegal entry into our country that it provides all the criminal groups with the capacity to be important actors in the generation of violence. We respect the origin of firearms that arrive in the hands of groups that generate violence in Mexico. We have detected an average of 70% originate in our neighboring country, the United States. The entering into Mexico is through contraband and the inordinate economical power that criminal organizations yield and allows them to acquire great quantity of arms, taking advantage of corrupt practices in custom officers and as well as lax restrictions to acquire them, and as well as outlets established at the border between the United States and Mexico for sale of guns. This firearm trade is an old problem in Mexico that has increased in the last years. For this reason, an important objective in the strategy for security of the government of President López Obrador has been the reduction in the trade of arms and illegal drugs from and to the United States, respectively. The security forces at this federal level, among others, that is, armed forces as well as security forces in the municipalities and states of this country that secure firearms, mainly by carrying out the activities to secure these arms and ammunition from the crime organization that transport and use them during the violent and criminal acts. By this effort, from the beginning of the administration of President López Obrador in December 2018 and until current time, we have seized 33,358 firearms, among which we can count 388 machine guns of .50 caliber millimeters, the famous Barrett. This is equivalent to a daily average of seizure between 20 to 30 arms, which are prohibited for use by the population. With regards to illicit drugs that represent a very lucrative business for criminal organizations, Mexico, because of its geographical location and soil condition, is a country that trades and produces drugs. The consumption is each time also something that requires the attention of the security agencies as well as health agencies. In the same period that I mentioned, that is between December 2018 to date, we have registered for safeguarding illicit drugs between 69 tons of cocaine, 98 tons of meth, and more than 30 million doses of fentanyl, in addition to 77 tons of various chemical precursors. In this regard, within the framework of the control of containers of the Office of the United Nations Against Drugs and Crime, Mexico participates in this mechanism in a very active way in order to strengthen the security measures, inspection, and examination with non-intrusive technology of containers to detect synthetic illegal drugs, as well as the chemical precursors and fentanyl. In order to achieve this, the security forces and customs continue work regarding inspections of containers at the borders, such as Tijuana, Ciudad Juárez, Nuevo Laredo, Reynosa, and Matamoros, which are carried out, which is what formed part of that commercial exchange between Mexico, United States, and Canada. Given how delicate the delicacy of the illegal transit of firearms in the United States to Mexico and the trade of illegal drugs from Mexico to the United States, the governments of both countries continue to have a permanent dialogue in order to arrive at common grounds, and this has been achieved by an innovative mechanism known as the bicentenary understanding, which is based on mutual trust and responsibility that is shared. This mechanism looks to make commitments so that generation of public policies towards the protection of the population from violence and crime in order to develop actions at the level of prevention of crimes that occur at the borders and to prosecute criminal networks, including money laundering. Just last week, a high-level delegation from the governments of Mexico and the United States met in Washington, D.C., in which main issues were combating the firearm trade and fentanyl. It was on the 13th of April when officers of Mexico and the United States made a commitment to increase cooperation to combat firearm traffics through special joint operations among various security institutions, institutions for investigation and prosecution. The officers of Mexico and the United States committed themselves to push forward a campaign of public awareness in which the citizens of both countries, particularly youth, will be educated on the dangers of synthetic drugs, including fentanyl, which cause irreversible damage to the health of our communities. In addition to what I said before, and in an unilateral manner, the past 12th of April, President López Obrador issued a decree for the creation of a presidential committee to combat the traffic of synthetic illicit drugs, firearms, munitions. In this special working group, federal agencies from the government of Mexico convene in order to support research and the arrest of individuals involved in the production and traffic of fentanyl. For the Mexican government, it is a priority to design and to implement public policies that are suitable, virtuous, multidimensional, and integrational in order to face the challenges in terms of security. With regards to 4 elements that we consider as the ingredients for the formula for generation of violence in the North American region, dialogue and collaboration between institutions as well as at the international level in order to share information, experiences, and best practice are added high-value elements that can yield results. I would like to end this intervention thanking all of you for your kind attention and expressing again in the name of the President of the Mexican Republic and of the Secretary for Security and Citizens Protection our best wishes for the success of this symposium in order to find better and more efficient ways to face the challenges that crime means to the region. Thank you very much.
General Louis Rodriguez Buchio for your contribution, of course, reminding us about the need for mutual trust and the shared responsibility. We move right now and we move along to a presentation by Mr. Miguel Reyes, the Deputy Legal Advisor in the Ministry of Foreign Affairs in Mexico, speaking to us about, yeah, that probably was if people are going overtime, but we don't need that again. And we'll be speaking to us about the country of origin gun manufacturers, corporate social responsibility, the Mexican experience.
Thank you. Thank you very much, and good afternoon to everybody. Can we have the presentation on the screen, please? Can you help me with the presentation? Thank you. I will start this conversation saying that I'm truly honored to be here. Thank you very much for the invitation to Mexico to participate this afternoon. And as we have already discussed, we are aware on the problems that we have in the region. You can see that you can see the image of a seizure that was recently taken in Mexico City. And unfortunately, this kind of seizure is the activity of every day of law enforcement officers in Mexico. This is some equivalent of the map that Lieutenant Colonel Jones showed regarding to the CARICOM region. But as you can see, in Mexico, there is only one store that sells weapons. And on the contrary, if you can contrast, the darker the color in the map of the United States, it's the higher the number of federal licensed dealers that supply weapons. And it is no surprise that the flow of guns comes from the United States according to traceability information. That is no surprise for anybody in this room. So after a very tragic incident that occurred in the city of El Paso, Texas, a border city with Mexico, it is why the government started thinking, the government of Mexico started thinking, what else can we do in order to stop the flow of weapons into our territory? How can we resort to courts in order to stop this flow? And we started a 2-year study in order to investigate what we can do, what we could do in order to stop this phenomenon. And we were aware that everybody was focused on what the governments were doing, on prosecuting people, on stopping, reinforcing their customs, but nobody had already asked what our companies were doing. That was the missing link in the middle that was lacking in the security strategy. And we were really surprised to see that there are the companies know or should know that their products end in the wrong hands outside the borders of the United States, and they do nothing to prevent that. And they don't not only do nothing, but they knowingly engage in commerce, and they prefer to make profits at the cost of innocent people. So what did we see? That the companies engage in illicit commercial practices, and that's why we resorted to American courts in order to file 2 lawsuits. The first one was filed in Boston, Massachusetts in August 2021 against 8 manufacturers. And what Mexico is requesting is that the judge orders that these companies implement the standards to reasonably monitor and discipline their chain of commerce. What Mexico is also requesting is that these companies incorporate current technologies to add safety mechanisms to prevent that an unauthorized user shoots a weapon. And also Mexico is requesting that these companies provide funds and programs in order to prevent gun trafficking. Mexico is also requesting a compensation since it is a civil lawsuit, but what Mexico is requesting is changes in the industry. So this lawsuit has drawn a lot of interest and a lot of support. There's a support that I want to highlight, which is when we filed the appeal 1 month ago, we received the support of different persons and entities through amicus curiae briefs, and one of those was filed by 5 Caribbean countries. That was Antigua and Barbuda, Belize, the Bahamas, Jamaica, and our host today, Trinidad and Tobago. We really appreciate the support on this litigation. And what has happened in our case? Well, in the first instance, the district court stated that there's one law that grants immunity to these companies. And unfortunately, even though the judge expressly said in his order, even though he's empathetic to the violence of victims of gun violence outside the United States, there is one immunity law that prevents him to continue the case. Of course, Mexico does not agree with this interpretation of law, and we filed an appeal, and we are in the middle of that appeal. Our arguments are that that law that was designed to provide immunity to those companies for damages that occurred in the United States, but since Mexico is claiming damage that has suffered in its territory, that immunity should not be applicable. And even though the law is applicable, the law has exceptions to that immunity. And these companies have violated several state and federal statutes that trigger one of those exceptions. We're really optimistic that we are going to prevail on appeal and that the case is going to move forward. We have also filed a second lawsuit in Tucson, Arizona. The first one was against the manufacturers, the distributors, and this one is against 5 dealers, 5 points of sale in the state of Arizona, in the city of Tucson, that is also bordered to Mexico City. And we have already identified that these 5 stores are among the worst offenders that that engage in straw sales or in multiple and repeated sales of guns that definitely end in the wrong hands for criminals in Mexico. What we're requesting in this second lawsuit is the main request of Mexico is that these dealers need to pay somebody to closely monitor each and every sale they engage in order to prevent their products to cross into the borders of Mexico. We're in the initial stages of this lawsuit. The reply from the defendant was filed on January. Our response to the reply of the defendant was filed 1 month ago. So we expect also to have a hearing in the course of this year. And finally, I will just call your attention into the advisory opinion that Mexico requested before the Inter-American Court of Human Rights, in which Mexico requested the opinion on several questions that can be divided into 2 categories. The first one is, what is the scope of the international responsibility of companies that engage in this commerce, especially what is the impact that the conduct of these companies have regarding human life and the right to life and the right to personal integrity. And the second one is, what is the scope of the obligations of the states regarding the duties to protect their populations? Is this law that grants immunities contrary to human rights? That is one of the questions that the court is going to resolve. The invitation is open to all the states and also civil society and observers to provide their opinions and visions to the Inter-American Court of Human Rights. The deadline is in July, so please, it would be really important to add those elements to the discussions. I just want to conclude stating that for us, it is really important to resort to courts. Our countries abide by the rule of law, and we believe in settlement of disputes, peaceful settlement of disputes. So please, let's continue resorting to the judicial arena in order to achieve our ultimate goal, which is provide safer communities to our population. Thank you very much.
Thank you very much, Mr. Reyes, for your contribution. Thank you very much for staying within the time. And I can assure you that we are going to be following this particular case. I know it was dealt with in a particular matter in the first instance, but certainly let's see what the higher courts will be saying, because whatever comes from it, I am sure we'll be able to use that level of learning and reasoning that will be given to determine how we chart forward. So thank you very much for sharing it. Our final presenter in this session is, in fact, Mr. Jonathan Lowry, who will be speaking on using litigation to prevent gun violence, the Mexican experience. Can we welcome him, please?
I'm going to start with a three-sentence version of my talk. One, can you hear me?
No. I think it's already.
Can you hear me?
Yeah.
Okay. I'm going to start with a three-sentence version of my talk. One, the main reason the homicide rate is so high in the Caracol...
Test, test.
Can you hear me? Okay. I'm going to start with a three-sentence version of my talk. First, the main reason that the homicide rate is so high in the CARICOM region is because of the flow of guns from the United States. Two, that flow needs to be stopped at the U.S. gun industry source. Three, litigation may be the most effective way to stop that flow. I founded Global Action on Gun Violence to work with and for countries, governments, to prevent gun trafficking, especially from the United States, including in impact litigation, which I've been engaged in against the U.S. gun industry for over 25 years. And I'm going to give a brief overview of the Mexico litigation, which I'm privileged to be counsel for Mexico in both of those cases, as well as a number of other cases. We all know the problem that the guns are coming from the U.S. It's important to know that Mexico's lawsuits do not argue that gun companies should be liable for gun violence simply because they make and sell guns. The theory is that gun companies should be liable because they deliberately choose to make and sell guns in particularly unsafe ways that they know or should know supply the criminal market. They do this in order to profit off of the criminal market, including the criminal market here in the Caribbean. Gun dealers know that straw purchasers, where one person is buying a gun for somebody else, is a major way that criminals get guns, but corrupt dealers have even been caught on videotape, as you see in this slide, explaining that they are engaging in an illegal straw purchase, which is a felony. And often the circumstances make it clear that gun dealers know or should know they're selling to traffickers because the trafficker is buying multiple guns, buying assault weapons, is returning to the store frequently, and often is paying in large amounts of cash. Gun manufacturers know who these gun dealers are. This is a stat from over 20 years ago where ATF reported that about 5% of gun dealers sell about 90% of the crime guns. And they're indicators as to which gun dealers are reckless or corrupt. Manufacturers also know that dealers are not effectively policed. So there are many dealers who are corrupt who still retain their federal license. And U.S. law enforcement has told gun manufacturers for over 20 years that they need to change their business practices because they are supplying the criminal market. But the manufacturers have refused. And in fact, they design and market their guns for increased lethality. There's been a lot of talk today about the rise of AR-15s in the Caribbean region. That rise is directly linked to U.S. gun industry practice to double down on AR-15 production. In fact, in 1990, the percentage of AR-15s that made up the U.S. gun stock was 1.2% of guns produced in the U.S. 30 years later, 2020, it's 23.4%. About a quarter of the guns made in the U.S. are now AR-15s. And they know those guns are used in mass shootings of children and others in the U.S. and by gangs in the Caribbean and cartels in Mexico. So the theory that Mexico raises is that the gun manufacturers can be and should be liable under basic principles of civil justice, negligence, public nuisance, and also that they aid and abet unlawful sales. And importantly, I mean, this is, even though these lawsuits are not against the United States and they are not against the Second Amendment, gangs in the Caribbean and the cartels in Mexico do not have Second Amendment rights, and gun manufacturers and dealers have no Second Amendment right to supply them. However, their practices are enabled by the weak U.S. laws, which I don't have time to go into in detail, but in the U.S., it is legal in most states to buy an unlimited number of guns, no explanation needed for why you want 100 AR-15s. There is no registration, there is no licensing. Military-style weapons are sold to 18-year-olds who are not allowed to buy beer in the United States. And the result of these practices is a booming gun industry and, of course, increased death in this region, throughout the Western Hemisphere, and in the United States as well. The solution, given my 25 years experience, is to cut off the crime gun pipeline at the U.S. source. The inside game that is attempting to move U.S. Congress has failed. The outside game, avoiding U.S. gun politics, can succeed. Litigation has reformed many other industries: tobacco, cars, now the opioid industry. And it can do the same with the gun industry, taking the profit out of supplying the criminal gun market, requiring safer practices, shutting down reckless gun dealers. In my experience over the years, we've accomplished all of those things in litigation. 84% decline here in one study from the crime gun supply of 25 dealers who were sued by New York. And that's an example of the sort of tremendous reduction in crime guns you can get from litigation. In 2000, Smith & Wesson entered into a significant deal with the US government, completely reforming its business practices because of litigation. It then was able to walk away from the deal, but it shows the potential impact of litigation, and there can be tremendous financial compensation as well. In cases I've been involved in, there's been over $100 million won for victims and survivors of gun violence against bad actors. There is special protection for the gun industry, as Miguel explained, but an international approach where foreign governments like Mexico and like the countries of the CARICOM region can avoid many of those special protections from the arguments that, one, the special protection law in the U.S. should not apply where the harm is caused outside of the U.S., and also, as Miguel said, because we fit under various exceptions to that law. Our plan is that through an international approach, which includes litigation, working with and for countries, we can reduce crime and also bring much needed compensation to victims of gun industry misconduct. And here's some of the services that we're a nonprofit that we provide. We'd very much be interested in working with all of you. So thank you very much.
Thank you very much to Mr. Jonathan Lowry. Can we hear it for all our presenters, Lieutenant Colonel Michael Jones, General Luis Rodriguez-Bucio, Mr. Miguel Reyes, and of course, Mr. Jonathan Lowry. And as we end this session, in the time allotted to us, might I just say, I know that there are some persons who have indicated that this is just perhaps another workshop and a talk shop, and it isn't. We've been hearing the contributions from those this morning, this afternoon, those to come after this session and tomorrow, and there clearly is an indication by what is being said, what is already being done, and what is in the pipeline to get things dealt with. And I just want to end by quoting from a former mentor, the late Black Stalin, who, whenever he had to inspire and remind people that when you are facing your darkest hour, it is not then to just drop tools and go away in despair. As our Honorable Prime Minister, Dr. Keith Rowley, said, there is always hope. And therefore, I end by saying, For our region may be facing its darkest hour, so our people need us today more than ever. But in our fight to recover, if ever you feel to surrender, is one little thing I want you to always remember. Together, we can make it if we try just a little harder. If we just give one more try, life will be much sweeter. I thank you very much. May God bless all of us.
Thank you to the panel, and of course acknowledging the moderator, the Honorable Justice Gillian Luckey, and all who participated in the discussion on transnational organized crime. Ladies and gentlemen, a minor amendment to our program. Dr. the Honorable Ralph Gonzalez's remarks have been adjusted and will be delivered during the course of Day 2's proceedings. We will move now to the economic perspective on crime and violence, and invite Dr. Randy Prasad of the University of the West Indies, St. Augustine, who will share a presentation on economic inequalities as the driver of crime and violence. We'll also have on stage in just a short while Professor Andres Rengifo, of the School of Criminal Justice at Rutgers University in Newark. And then we'll move on to a discussion on the social perspective on crime and violence with an overview from Trinidad and Tobago, a presentation on gang activity and social determinants. I'll invite Dr. Wendell Wallace to also make his way on stage, and Professor Anthony Harriott to also join us on stage. In a short while, I'll introduce as well the moderator, Dr. Rohit Doon, who will also be part of the panel for the discussion. We'll be joined by the Minister of Social Development and Family Services for Trinidad and Tobago, Senator the Honorable Donna Cox. However, Minister's presentation will be at the podium. She will not be part of the panel review thereafter, but will be, of course, presenting in this segment. Dr. Doon, do you care to deliver any introductory remarks before we start, or can we proceed?
Not really.
You're good, right?
Yeah, I'm good.
Very well. Okay, so without any further ado, ladies and gentlemen, economic inequalities as the driver of crime and violence. From the University of the West Indies, St. Augustine, Dr. Randy Prasad. Please welcome him.
Good afternoon. All protocols observed. There was a slight change that I think the speaker who introduced wasn't aware of, but I'll correct. Both Professor Rengifo and I are looking at the economic cost of crime, whereas I am looking at it from a regional perspective. Professor Rengifo is looking at it from the perspective of Trinidad and Tobago. So at the outset, one of the things that I want to stress is that the cost of crime goes far beyond just the economics of crime. The cost of crime is psychological, it's social, it affects the healthcare system, it affects communities, it affects families. Even when we talk about the cost of crime and we look at the things that are measurable and we calculate prison costs or costs that go with the police service, there are other costs that we sometimes neglect. For instance, investments from external businesses, the effect on the tourist trade, etc. So there are tangible costs, there are intangible costs. In this particular slide, I look at some crime data, not for the sake of presenting crime statistics to you, which you already know, but merely to highlight two things. When we look at the cost of crime, one, crime is very high in the Caribbean region compared to other parts of the world. This we know. The second thing, quite importantly, is that what we know from police statistics really is just a fraction of all the crime that is happening. If you look at victimization surveys around the world, they'll tell you that there is far more crime happening than is reflected in police statistics, sometimes many, many times over. And when we go to various sources to estimate the economic costs of crime, if we rely only on official crime data, then we very severely underestimate the economic costs of crime. Luckily, we know this, and we're able to make fuller estimates of the cost of crime. Now, while I focus in the next few slides on businesses, just to remind you that the cost of crime goes far beyond businesses. We're talking about the costs of imprisonment, the costs associated with the judicial system, the cost of the police service, not just the costs of Ministry of National Security healthcare system, and the costs associated with intentional injuries, etc., etc. This particular graph shows you perceptions of persons from businesses in terms of whether theft and disorder represent a serious obstacle to doing businesses. And you see certain countries standing out there in terms of the issue being very serious or a major obstacle. Countries include Belize, Guyana, and Jamaica. But you even notice if you look in Trinidad and Tobago, the deeper colors to the very top of the graph there show that a large proportion of persons as well in Trinidad and Tobago believe that it's a very serious obstacle. In this particular chart, it shows firms that experience losses as a result of various types of victimization in Caribbean countries. And you see countries that really stand out there at the very top: Guyana, St. Kitts and Nevis, Suriname, Grenada, and Dominica. This particular chart shows you the types of victimization that are experienced, and the figures are self-explanatory. So you have a sense of what is happening among businesses. Of course, this represents just some of the types of victimizations. Now we know there are other types of very, very serious threats out there, one of which is cybersecurity. And very recently, the folks at ITAC, I know, did an exercise with UWI, looking at the penetrability of various public sector systems, and the infrastructure Caribbean-wide is pretty weak. Anybody with a moderate level of skill in terms of hacking into systems can hack into your systems and create havoc. They can encrypt your data, and you'll have to pay a ton of money to get it back, etc. So the threats to businesses, the threats to the economy, to national security, etc., goes far beyond just what you see in this particular chart. Here we look at losses due to theft and vandalism as a percentage of annual sales. You see countries that really stand out there: Suriname, Jamaica, Guyana, and Grenada, above the average for the Caribbean. Here we look at the percentage of money that businesses spend on security issues by country. And you see Trinidad and Tobago, the Bahamas, St. Kitts and Nevis, Jamaica, and Suriname standing out at the top in terms of percentage of business money spent on security issues. This particular one looks at security costs as a percentage of annual sales, and Suriname, Guyana, the Bahamas, and Grenada stand out at the very top. In this particular slide, we're comparing Latin America and the Caribbean region in terms of crime-related costs to different parts of the world. And you see that in this 2017 study that was done by the IDB, the figure stood at 3.555% of GDP. 3.55% of GDP, and more than likely, this is what we're able to calculate, more than likely it's actually more than that, all right? And this final slide breaks down the costs in terms of some of the core areas: public spending, private spending, social costs, and other costs due to imprisonment, into different regions. And you see the breakdown there for you to give you a sense of the economic costs of crime across the region. So the bottom line is that the cost of crime goes far beyond just the economics. If the economics of crime or the economic cost of crime isn't a big enough motivation for us to really do something serious and to really recognize that if we could make a dent, the Caribbean region's cost is twice what it is for the rest of the world. If we could make a dent in crime statistics, there is an economic gain to be had. Money that could go to education, to healthcare, etc., that is being lost to crime. Thank you, ladies and gentlemen.
Thank you, Dr. Sipasad, for that perfect segue into the next presentation. We have coming up Professor Andres Rengifo from Rutgers University, who is here courtesy of the IADB. Kudos to the IADB. And he was visiting us. He had been here last month, spent a couple of weeks with us to assess the economic dimensions of crime and violence in this country. Dr. Rengifo.
Thank you, Doctor. Good afternoon, everyone. It's a great pleasure to be here. And as a researcher, I'm very excited about the conversation that we've been having today. But also as a Colombian, it's very good to be here. I feel like I'm visiting my cousins coming here to Trinidad. So thank you for hosting me. I'm also very happy to be part of this ongoing effort, cabinet level, appointed committee by Prime Minister Rowley, thank you, co-chaired by the permanent secretaries of the Ministries of Health and Social Development and Family Services. This is a committee that was established last year. So I'm a leader for a team that's supporting the work of the committee, and in this presentation I'm hoping to share with you some of our ongoing work trying to assess and update some of the numbers that we have on the economic cost of violence. So it's not about crime, but interpersonal violence, specifically with some of the caveats that have been already presented in terms of how difficult it is to examine violence and its impact on individuals and families from this economic perspective, because there is a lot that goes into the impact of violence that's intangible or that is invisible or that is long-term, and it's hard to capture using some of our standard metrics. So we know that violence harms the most vulnerable, young, mostly male and mostly poor people who are in our societies, often at the margins of that society, and strains, sometimes overwhelm support systems and ways by which we provide support, formal or informal, in communities and governments. But also, as we've discussed so far, violence varies. There are different expressions of violence, that they don't take the same form, they don't have the same impact, and they may not be addressed in the same way. And one way by which we can think about it is in terms of severity of violence. So I'm using here two of the charts that we've produced, using our conversations with people in Trinidad and Tobago, looking at the data that has been produced, and also compiling information from other sources. So we know that some forms of violent crime have been increasing in Trinidad and Tobago, not all of them. The commissioner early this morning spoke about this paradox where we see some violent crimes, murder, for example, going up, but other violent crimes going down. So this is not actually a chart about trends, but a chart of the number of crimes that we're looking at. This is the pie on your left. So we see that murders actually are a very small fraction of all offenses. Oh, where's the presentation? Okay. Thank you. So we see on the left chart that murders, there are only 600 and plus compared to the number of other offenses that we're looking at that are violent in nature. So here in the blue slide, this is domestic violence expressed in the form of physical injury. So not all forms of domestic violence, but violence, domestic violence associated with physical injury. And on the right chart, we see the economic cost that we've calculated. So while murders represent less than 1% of all interpersonal violence incidents in Trinidad and Tobago, they represent about 20% of those economic costs. So for every one of those murders, we're going to look at them in a second. We estimate that they cost approximately, in Trinidad and Tobago, approximately $350,000 US. Our estimation is that interpersonal violence costs the country approximately $1 billion a year. And we're going to talk a little bit about how we get that number. So the first thing we did, working with the committee, was to examine the manifestations of violence that everybody understands and we all deal with, examine in different ways on a regular basis. We talk about youth violence, we talk about gang violence, we talk about firearm or gun violence, But these forms of violence need to be, in a way, traced to specific crimes. And so we can see that gang violence is typically associated with murders, but gang violence may be also showing up in woundings and shootings, may be showing up in school fights, may be showing up in other forms of violence that are less likely to be recorded. The same thing with youth violence. Youth violence is not a crime per se, right? So youth violence is expressed through a number of different indicators or specific crimes in our legal codes. So to look at measurement, we use administrative data, often in the form of police data by TTPS, but we also relied on information by the Ministry of Health, collected using forms that we developed, but also in connection to the injury surveillance system that is operating in some parts of the country. We also look at data from the Ministry of Education for school fights and assaults. We also look at other data in the form of victimization surveys that in this case are very important because they allow us to track the incidence of crime beyond what's reported to the state. So for example, of all the crimes that I'm listing in this presentation, only about 2% of those crimes are known to government authorities. A lot of those other crimes are underreported for a number of reasons, most of them because they're tied to domestic violence incidents that do not necessarily make it to hospitals or to the police authorities. So this is the table that we developed, and that we divide costs in 3 types of costs. Direct costs to victims. So what happens to victims? Victims of violence that have to secure support, that cannot work, that have to move, that have to address their mental health concerns. Costs to the criminal justice system and to government in general in the form of policing, the judiciary, prosecution, public defense, prison, parole, and probation, and then other tangible costs associated with the provision of school safety, private security, and opportunity costs for people who are not in the labor market and who decided to engage in a life of violence. So on the left side, you see the different types of crimes that we're tracking. Murders, obviously, but also other types of crime that have been adjusted because the administrative records, for example, in the case of things like woundings and shootings, would suggest that in the country there are about 700 of those incidents reported to TTPS, but according to the National Crime Victimization Survey conducted in Trinidad and Tobago, that number you need to multiply it by about 24 times in order to get the actual prevalence of those woundings and shootings using data from surveys. So I'm not going to bore you too much at this stage of the day in terms of costs. You see that we start to break down then how these costs operate in the case of the different incidents of crime. And then we aggregate them up and come up with that figure of about 6 billion Trinidad and Tobago dollars, about $1 billion spent, about 4% of the GDP on violence alone. We did this over time. The numbers don't change very much going back to 2020, and then there are some confidence intervals around those numbers. I'm running out of time, but these numbers in a way match what has been produced at the regional level. And I will highlight, though, that once you translate these costs in terms of the budget of the different ministries, you see that this cost is very high for specific ministries associated with the prosecution of crime. About 54% of their budget, we estimate, is associated with the response to violence, 24% of the budget in the case of the Ministry of National Security. I'm going to stop here. There are a number of things that I would love to talk about. We can do this at a later point. Yeah. But things that are working and things that can be used in the short term and in the long term. Thank you.
Thank you, Professor. Let's move along.
Thank you, Professor, and thank you, Dr. Overduen. We'll now invite the Minister of Social Development and Family Services of Trinidad and Tobago, Senator the Honorable Donna Cox, who will share an overview from Trinidad and Tobago.
Thank you very much.
Ladies and gentlemen, we aspire to have a stable society and healthy, happy families such as the ones depicted here. The family is a major institution that contributes to the growth, development, and stability of our nation. Put simply, healthy families equal safe communities and safer societies. When we view our current social landscape, we recognize that some families need extra support to achieve this ideal. We often get caught up trying to find out who are committing crimes, where are they happening, why are they happening. But there's one important aspect we sometimes neglect to consider: how social determinants affect families and their likelihood to engage in criminal activities. And these social determinants can be complex and intertwined, but they play a significant role in influencing behavior. It is therefore critical that we acknowledge the gravity of this issue and take action to address it. There were almost 10,000 cases of domestic violence reported to the Trinidad and Tobago Police Service between 2018 and 2022. And we lost 175 lives to domestic violence. Another 504 lives were lost to suicide. Even more startling is the number of incidents involving sexual and physical abuse and neglect of our children. Annual reports from the Children's Authority between 2017 and 2022 indicate that there were 5,340 reports of neglect, 5,267 reports of sexual abuse, and 3,530 reports of physical abuse. Between August 2017 and July 2022, 1,811 children were before the court for criminal matters. 1,405 cases were filed for children in need of supervision. 27,095 cases filed for domestic violence. 8,608 cases filed for maintenance. 13,222 cases filed for divorce, and 2,487 custody matters were filed. So, ladies and gentlemen, these are not just crime and social services figures. For us, this data represents broken families, affecting thousands of our citizens regardless of age, gender, race, or economic circumstances. The sum total of these numbers paint a picture of families in crisis. And families in crisis mean communities in crisis. Communities in crisis means a nation in crisis. And when this spread across the region, we can safely say that our region is in crisis. Here are some additional factors which we have observed, which also contribute to the breakdown in family: poverty, unemployment, culture, teenage pregnancy, illnesses, mental, physical, or behavioral. Well, COVID-19, which was mentioned earlier today, because we have some issues with regards to COVID-19, migration, and of course, social media influence. But I want to hone in on the issue of parenting, because we have found that poor parenting is a major issue in Trinidad and Tobago. It can increase the likelihood of a child engaging in criminal behavior later in life due to delinquency and violent crime. And in some families, it is reported that the gangs have taken over the roles of the parents, guiding our young men and women and providing them with a false sense of safety and security. Poor parenting has a range of adverse effects on children, including, but not limited to, difficulty forming healthy relationships, lower academic achievements, increased risk of substance abuse, mental health problems, increased risk of criminal behavior, and increase in school violence. And speaking of school violence, the Ministry of Education reports thus far for the academic year of 2022-2023 were suspended from secondary schools for offenses ranging from arson, assault, with or without weapons, cyberbullying, and possession or use of drugs and explosive devices, to name a few. Primary school students, who are generally 12 years and under, accounted for an additional 463 suspensions for similar offenses, including one child for leadership of a gang. And these findings are extremely disturbing. And what about the media reports of parents entering schools to fight or violently engage teachers and students? That in itself is also similarly distressing. So the data I have presented, when combined with each other, they create the perfect storm. So how has the government of Trinidad and Tobago responded to this? The government established a committee to take a holistic public health approach to crime and violence. And this committee is co-chaired by the Ministry of Social Development and Family Services and the Ministry of Health. And that committee has been mandated to develop a national action plan. Ladies and gentlemen, this strategic approach to crime prevention begins with the family, as you can see on this slide. At the Ministry of Social Development and Family Services, our program of work involves, but is not limited to, the following: creating and maintaining a robust national poverty reduction strategy, empowering our clients with the tools to make better, more informed decisions that contribute to their good health and well-being. And of course, we pay special focus on the vulnerable sections of our society. We engage stakeholders to collaborate, share ideas and resources. We are indeed improving our policy and legislative agendas and becoming more client-driven. We continue to implement policies and programs that will fulfill the basic needs and, of course, reduce poverty. And this includes the provision of grants which support over 200,000 households per year in Trinidad and Tobago. And we are also making our services more convenient, accessible, user-friendly, cost-effective through our digitalization efforts. We recently established a suicide prevention hotline because there has been an increase in suicides since COVID-19. We introduced our Step Up program with the aim of transitioning clients through the welfare system to move from dependence to independence. And we started a values, attitudes, and behaviors campaign, which aims to revive core family values that were spoken about today, right? Because there are some of these values have been lost, and they are no longer dominant in our society. More importantly, we are giving families the tools needed to make better decisions and improve lives by providing psychosocial and counseling support. We have been hosting parenting, co-parenting, and grandparenting workshops because when our family social workers go into the community, they recognize that there are many children being raised by grandparents. Many families are broken due to parents being either incarcerated, deceased, or absent. And in those instances, the grandparents often step into the role of the primary caregiver or as father and mother. And to this end, we recently launched a grandparenting program. A co-parenting workshop, because there are many conflicts that arise because of co-parenting. So we have held a co-parenting workshop, and we included inmates from the Trinidad and Tobago Prison Service. There is an inmate development program, and we included them into our parenting workshop. Over the past 7 years, the government of Trinidad and Tobago spent approximately $40 billion on social services, 40 billion TT dollars on social services. And we will extend our net further to ensure better outcomes for our citizens and ultimately reduce crime. Our continuous data gathering will drive decisions that identify misaligned strategies and help us to reframe. We should measure our success not by how many persons we put on grants, but how many we take off and empower to become more self-reliant. But we must partner with each other share ideas and resources, exchange experiences, and draw from practices. And this begins with collaboration, people to people, organizations to organizations, community to community, business to business, government with business, business with government, government to government. Our crime fighting initiatives must also focus strategically on social determinants, which include parenting, values, attitudes, and behaviors, and of course, the family unit. And it is from the family issues emanate and spill over into the wider society. The current state of our nation is a reflection of the breakdown that is occurring within families. So prime ministers, delegates, specially invited guests, I wish to reiterate the importance of looking at the social determinants of crime and violence. According to Blanche Lincoln, a former US senator, stopping crime before it occurs is the most effective tool of all. We must act quickly. There is no better time than now. I thank you.
Thank you, Minister, for your passionate advocacy on the importance of family and parenting in that context. I'll move along to our next speaker from the University of the West Indies, Dr. Wendell C. Wallace.
Thank you, Chair. Thank you, Chair. Honorable Prime Ministers, members of Parliament, members of the media, specially invited guests, members of the judiciary, good afternoon. To my fellow panelists, good afternoon. It's indeed a pleasure to be here this afternoon in the midst of so many illustrious minds, Caribbean thinkers and leaders, as well as a panel of my peers. Indeed, it's a pleasure to be sharing the stage with Professor Harriott to my left, who was my academic examiner for my dissertation, my PhD dissertation. And for those of you who are familiar with academia, you will know that the examiner normally exudes a certain level of academic rigor on your dissertation, and Professor Harriott did that. It didn't break me, it made me, and I am happy to be sharing the stage with Professor Harriott this afternoon, looking at the social determinants, but more specifically looking at the social perspective on gang activities. Crime and violence, crime and gang activities are all part of the complex social phenomena. And because it's a social phenomena, this calls for explanations and understandings from a social perspective. So rather than examining the perpetrators for the causes of crime, violence, and gang activities, the social perspective examines the social situation for causal factors. So what is the social perspective? The social perspective says that gang activities is not an individual problem. It's not an individual problem, but it's shaped by broader social structures and cultural values that are often rooted in inequality and injustice in many societies throughout the Caribbean. The social perspective framework also examines how social factors, poverty, inequality, and social norms contribute to criminal behaviors, gangsterism, and violence. For example, people residing in poverty are more likely to engage in criminal behaviors as they lack access to resources and opportunities for success through legitimate means. Further, people who experience discrimination, marginalization, and stigmatization, they also have a greater propensity to engage in crime, gangs, and violence, either as a way of expressing their frustrations or as a way of seeking justice. In the interest of brevity, I will not go very deep into the public health approach as Dr. Joy St. John, if I have the name correct, spoke to this a bit earlier. But globally, what is noted is that crime prevention and reduction strategies, they have adopted that public health approach. And instructively, the public health approach does not replace the criminal justice system approach, or the combination of other approaches. Indeed, what it does is that it works alongside the criminal justice approach to bring different views, different actors, different resources to the task of crime prevention and reduction. In other words, the public health approach to crime reduction and crime prevention, it's a complementary approach, and it focuses on the well-being of community residents. When we look at gangs in the Caribbean, one thing that we can be sure of is that throughout much of the Caribbean, gangs are a social problem. And they develop from core structural problems, and they generally allow people to join gangs due to a variety of socio-ecological factors. In fact, Professor Harriott, in one of his past publications, has noted that throughout the Caribbean, for almost every country that data is available, crime as well as gang activities has been on the rise since the year 2000. When we look at the social perspective and we try to incorporate it with the crime reduction and crime prevention strategies, the question that we should all ask, and answered in the context of gang activities, or the question that we should not ask is, why does gang activities occur? The question we should ask is, why does this socially undesirable behavior occur with greater frequency in some communities and circumstances than in others? And the answers that we gather from that question is what we should use to frame interventions on the social perspective. At this time, as we speak, I am conducting research on gang activities in Trinidad and Tobago using several of our marginalized and stigmatized communities. And preliminary results indicate that weak, immobile justice systems, low social control, reduced social capital and community efficacy, weak parenting, stigmatization of both communities and residents, the inability of some individuals to delay gratification, limited and blocked legitimate opportunities, little community resources, as well as poverty are all contributors to gang activities. And while this study is being conducted in Trinidad and Tobago, I'm certain that the results can be juxtaposed throughout the entire region. On the other hand, the social perspective also indicates that there are impacts of gang activities, and these are some of the impacts. You have a decline in the provision of social services and amenities, increased injury, increased mortality rates, and when you look at that factor, that cements the rationale for using the public health approach. To conclude, gang involvement and prevention strategies cannot be viewed in isolation. Prevention and reduction efforts must adopt a multidimensional approach by adopting a whole-of-society approach, and that had been alluded to earlier by Mr. Chambliss from PAHO. Indeed, when we look at the Caribbean, when we look at research conducted throughout the region, it is evident that we have become so siloed and so boxed in to our approach in terms of crime reduction and crime prevention. In fact, there's a pervasive view that crime reduction and crime prevention, they are the sole purview of the police. However, the Honorable Prime Minister of Jamaica, the Honorable Mr. Andrew Holness, indicated that we must be able to move beyond policing strategies and use a range of other strategies. The public health approach, the community approach, have parents involved, the communities, the churches, and this more or less cements that whole aspect of the public health approach to crime reduction and crime prevention. Thank you.
Dr. Wendell Wallace for assisting me by introducing Professor Harriott in advance, as he represents such high degree of academic rigor. Professor Harriott?
Sure. Thank you. Perhaps you could put up my slides. Yeah, good. Honorable Prime Ministers, distinguished ladies and gentlemen, I've been asked to speak on the social determinants of violence, and I'm going to do it with special reference to that youth problem set and gangs. Now, this is a rather expansive and complicated matter, and therefore, in the 7 or so minutes that I have, of necessity, my comments have to be very, very limited and perhaps a bit simple. Now, if I may borrow the words of Prime Minister Motley, something is fundamentally wrong. When we examine all the data on violence within the region, you cannot but come to that conclusion, that something must be fundamentally wrong. The rates of violence across the region, with some exceptions, is just too high. You're all by now familiar with the data, so I need not repeat. But importantly, the violence is just too much into the social mainstream. It's too much a part of everyday social interaction. When you look at the data from the violence surveillance systems in our hospitals, some of which was presented here today, but take the case of Jamaica. We have between 1,200, 1,400 incidents of murder every year, and much of that has to do with conflicts between hardcore career criminals, if you wish, life course persistent criminals. But when you look at the data from the surveillance system, and you see 25,000 incidents of serious injuries in a given year, these are folks who report to the hospitals for treatment. That can't be attributed to criminals on the fringes of society. That's in the mainstream. So it's just too central. When you look at the domestic violence data, it further supports my point, right? It's in the mainstream. And that must tell us that we have to get to fundamentals. We have to get to basics. And I'd add another point. It's too resilient to treatment. Everybody in law enforcement in this room knows what I'm saying when I say it's too resistant to treatment, it's too resilient. Much has been tried. Some successes, yes, but the successes are not commensurate with the effort, right? So we have to get to basics, and I just want to open up that discussion. And if I may push this a little further, in the most general sense, if I were to provide an answer to this question as to why something is so fundamentally wrong, I would have to say, let us re-examine our development thinking. At the dawn of independence, part of the answer to this has to do with, I think, just the intractable social problems that we inherited from the colonial era. Deep marginalization of not minorities, but majorities of our population in many instances. So that's a huge development challenge that we inherited. But beyond that, we have to ask questions whether we have gotten our approach to development completely right. Note I'm using not my language. I'm trying to be very careful here. I don't want to say it's all wrong, right? And I'm saying that we have to go back and look carefully at our developmental models. So with that in mind, let me just draw your attention to some findings from some of the more robust studies that have been done on the Caribbean as a whole. I don't want to get into the specifics of countries now. And there are differences, of course, across the Caribbean. But we can look at some relationships. As I said, I'm focusing on that problem set associated with the youth because they account for most of the offenders, they account for most of the victims, in particular the young male. So take a look at that first slide. That's from a cross-national study of around 30 or more Caribbean countries. And it was done by UNODC in partnership with the World Bank. And that regression line that you see running through the dots there pretty much captures the average effects, the relationship between your murder rate and the proportion of young men in the population. And you see, as the proportion of young men increases, your murder rate tends to increase. That's a basic demographic issue, right? And in many of the Caribbean countries, our populations tend to be young. So that's the first hint of a problem there with the young male. If we may turn, let me turn to the next slide. And that is again, your homicide relationship with basically school retention, the number of years of high school education, or number of years of education period. So as the average number of years of education increases, your murder rate decreases. There's another study that a group of us of UWI did, and that was a Jamaica study in which we probed the relationship of a number of violent crimes, homicide included, the relationship between homicide, rape, other violent crimes, and educational enrollment or access. And the findings there were interesting. In fact, we found that when you increase access, you increase, or you tend to motivate increased rates of rape. So generally, I don't want to get too deep into this because we don't have time. But the point here is that access to education may complicate the violent crime problem. We have a huge legacy of our population not having access to education. We have tried to solve that and made great progress on it. But the key thing now, if we are interested in the relationship between education and violence, is to improve the quality of education, and to improve school retention by our males. And we have to develop programming. I'm racing ahead. But we have to develop programming to do these things. We have to take a look, very fundamental look, at what we are doing in education at all the different levels, is the point that I wish to make here. Third set of findings have to do now, as we shift from education to work, the relationship between homicide and other forms of violent crimes and youth unemployment, not employment. I really want to stress this distinction because the relationships are very different. Across several continents, the finding holds. As your rate of youth unemployment increases, your homicide rate will tend to increase. And the opposite, of course, is true. Findings in West Africa, findings in parts of Asia, and here in the Caribbean as well. So I've highlighted the two of the big issues with our young people, and that has to do with education and unemployment. Now, all of this comes to a head when they are faced with at least two key transitions in their lives. The transition from school to work and the transition from adolescent to adulthood. We're stressing the objective issues of access to education and unemployment, etc. But here, a number of subjectivities, important subjectivities arise, partly to do with identity. So for the males, and you are in this no man's land, this liminal space, are you an adolescent or are you an adult male? What's happening? You become kind of hypersensitive to things like what you call dissing. You're disrespecting me, right? And I reply with aggression and violence. They're trying to sort out these identity issues and become super sensitive to these kinds of problems. We have to develop programs that directly address this period of liminality in their lives, when they are neither here nor there, they are in between. They are in a state of becoming, and that period can be lengthy for some males, especially those that drop out of school early, right? It can be between 16 and you don't get a job until you are 23, 24, because in your communities, you're faced with chronic youth unemployment. Not high youth unemployment, but chronic, right? And when it is chronic, you look to alternatives. And the gang helps to provide those alternatives. It helps to include some of the issues of identity, because one of the things that gangs do is it gives you an identity. And it gives you a sense of being powerful. And most of all, it gives you a sense of being a very masculine male. Right? So it solves many problems that the formal system isn't solving. I perhaps have run out of time already. The final thing that I wanted to do was to tease out what this means for some of our programs, but I've hinted at it before, right? It's education, looking at education in a very fundamental way. It's looking at bridging programs between having left school and finding work. It's looking at school retention. It's looking at the identity problems. And some of the countries have done fairly well. Jamaica has a number of institutions that other countries may want to look at. But and I know that in the Eastern Caribbean, in some countries, we have youth resilience programs now as part of the crime prevention menu, but maybe we need to re-examine some of those programs in the light of some of the findings that I've tried to bring to your attention. Thank you.
Thank you, Professor. So in closing, I'd like to thank my Prime Minister for placing this issue at the top of the must-do list. Thank you, Prime Minister. In addition, the socio-ecological model requires an examination of relationship between perpetrator and victim, which may either be risky or protective. Growing up, my parents would always tell me, you can judge a person by the company you keep. Be careful, be wary. And so in that context, let me share with you a few lines of poetry. It was an evening in November. As I very well remember, I was walking down the street in drunken pride when my knees were all aflutter. So I landed in the gutter, and a pig walked up and laid down by my side. As I lay in the gutter, thinking thoughts I could not utter, when a lady passing by did softly say, "You can always tell about the man that boozes by the company he chooses." And at that, the pig got up and walked away. So good night and God bless. See you all tomorrow.
An important perspective as we conclude the day one of the regional symposium, and to all those who've been joining us online and on social media and broadcast media, we thank you for being with us and invite you to join us tomorrow from 9 o'clock in the morning. For those of you who are leaving us, farewell, good evening.